shop for everything you need to know about what's going on in politics today.
I wonder if this is a deal that might need to be like the biscuits in this factory, twice baked.
Is there not an opportunity here to win out against the extremes?
Tom Harwood, GBNews.
What are you going to do about it?
Things should have been done differently, and they certainly are being done differently.
Don't miss it. The Briefing with me, Tom Harwood, 9:30 Monday to Friday on GB News.
Join me, Nana Akue, Saturday and Sunday afternoons on GB News. Expect fiery debate and passionate discussion as me and my panel tackle some of the biggest topics hitting the headlines. It's a place for everyone's opinion. No one gets cancelled, but no one gets an easy ride.
Oh, she's on it today!
Be ready for conversations that are fierce, frank, and of course, fun. Every Saturday and Sunday afternoon from 4 p.m. on GB News, the People's Channel.
Very good afternoon to you. This is GB News Live. Here's what's coming up for you today. It might be a new year, but it's the same strike season as train strikes kick off again today. Mick Lynch criticising the government, saying they're not taking negotiations seriously. So what can the government do to finally resolve the issue? We'll have the latest throughout the programme. Health leaders have warned the crisis engulfing the NHS will continue until Easter, as senior doctors accuse ministers of letting patients die needlessly through inaction. More than a dozen trust and ambulance services have declared critical incidents over recent days, with soaring demand, rising flu and COVID cases, and an overstretched workforce piling pressure on the health service. And today is the funeral of the football legend Pele. These are the scenes in Sao Paulo in Brazil as crowds are gathering in celebration of his life. We're going to bring you the latest throughout the programme. Also today, the Irish Prime Minister Leo Varadkar said mistakes were made on all sides in the handling of Brexit, vowing to be flexible and reasonable when attempting to solve issues with the Northern Ireland Protocol. He said the post-Brexit protocol is too strict, and he understands unionist concerns that the treaty has made them feel less British. We'll be analysing what may come next in these negotiations. And of course, we want to hear from you as always. Get in touch, gbviews@gbnews.uk. Before all of that though, Tamsin has the latest news headlines.
Stephen, thank you and good afternoon. From the GB newsroom, it's 1 minute past 12. Train passengers are being warned of significant disruption this week as over 40,000 rail workers stage fresh strikes. Members of the RMT union at Network Rail and 14 train operators will walk out for 48 hours from today and then again on Friday, whilst drivers in the ASLEF union will strike on Thursday. It's part of the long-running dispute over pay, jobs and conditions, which RMT General Secretary Mick Lynch told us is vital for the future of the industry.
It's up to the government now to show us that they mean business and that they want to facilitate some talks, rather than undermining them, as we believe they did before Christmas, by putting provisions in that they know none of the railway unions can accept. So if we can get some realistic talks with some proper proposals and progressive talks, we'll work with all the parties to get that on.
Our Transport Secretary Mark Harper says it's time for the unions to get off the picket line and round the negotiating table.
Government's going to continue to work really hard to try and help bring the two sides together to get this resolved. I know how frustrating this is for commuters, and the danger is it puts people off using the railways, which is a bit of self-harm on the part of the rail unions that haven't settled this dispute. What I think the government can do is make sure there's a fair and reasonable offer on the table, which there is, facilitate those negotiations between employers and trade unions, and try and make sure we get this dispute resolved for the travelling public.
Health bosses are calling on the government to respond to mounting pressure within the NHS, with top medics describing the current situation as unbearable. The Royal College of Emergency Medicine says somewhere between 300 to 500 people are dying each week as a result of delays in urgent care. The government says it's giving the NHS and social care sector an additional £14 billion over the next 2 years. Former Health Secretary Stephen Dorrell told GB News other parts of the primary care system need to be better utilised to ease pressure on the health service.
Also about the pressures in primary care and through GP services, through better use of other parts of the primary care system, notably pharmacies, so that people can have ready access to the right level of support. It's unhelpful, I think, when people say or imply that the only way you can get healthcare support is by seeing a GP. That's nonsense.
The Transport Secretary says people travelling to England from China will not be forced to quarantine if they test positive for COVID on arrival. However, testing will be optional for passengers landing at London Heathrow. Under new measures announced by the government, people flying to England from China will be required to show a negative COVID test before boarding the plane. Low-income households will receive £900 cash support this spring to help with the cost of living crisis. The government says the money will go directly to bank accounts in 3 separate payments. But campaigners argue support for the most vulnerable has not increased on what was announced last year despite rising costs. 8 million people will be eligible, including those on universal credit, pension credit and tax credits. 2 British citizens are among 4 people killed in a mid-air crash between 2 helicopters in Australia yesterday. Diane and Ron Hughes, aged 57 and 65, from Merseyside, were on holiday when the accident happened in Australia's Gold Coast region. 3 others were left critically injured. Queensland police say the initial investigations indicate the collision occurred when one helicopter was taking off and the other was landing. Russia says 63 of its soldiers have been killed in a Ukrainian attack in the occupied region of Donetsk on New Year's Eve. Ukraine initially claimed it killed 400 Russian fighters, a claim Russia's called an exaggeration. The attack hit a building in the city of Makiva, where Russian forces have been stationed. An NFL player is in a critical condition after suffering a cardiac arrest during a game in Cincinnati. The Buffalo Bills club has confirmed Damar Hamlin collapsed on the field after a tackle in the first quarter against the Cincinnati Bengals. The 24-year-old is currently in a critical condition in hospital. The game was postponed following the incident. Brazilian footballing legend Pele is due to be buried today. Thousands of fans have gathered to pay their respects and file past the coffin at the grounds of his former club Santos. Pele lost his battle with cancer last Thursday. The 3-time World Cup winner was 82. This is GB News. We'll bring you more news as it happens, of course. Now, though, it's back to Stephen.
Tamsin, thank you. Now, 40,000 members of the RMT have started their first 2-day walkout of the week today, with Network Rail saying the strikes are going to result in about only 20% of services running. Now, this comes as commuters return to the office, of course, sparking fears that people will give up on train travel for good. Well, earlier we spoke to the Transport Secretary, Mark Harper, who maintained the government is working hard to resolve the dispute, and he urged the RMT leader, Mick Lynch, to negotiate.
Offer was put to rail unions. 2 of the unions accepted that deal on Network Rail. The RMT, about a third of their members did vote for it, even though they were instructed not to. But they're still not willing to settle what is a very fair and reasonable offer. So look, government's going to continue to work really hard to try and help bring the 2 sides together to get this resolved. I think my New Year message to Mick Lynch would be make a New Year's resolution, get off the picket line, round the negotiating table, and let's get these damaging strikes to an end. There's a fair and reasonable payoff on the table for the people you represent, Mick. So let's get round the table and let's see if we can get the dispute sorted out.
Well, let's head to Euston Station then, and our national reporter, Paul Hawkins. Afternoon to you, Paul. So, the government saying they're being fair and reasonable. What's the RMT saying?
The RMT are saying, look, we're happy to get around the negotiating table, but the fundamentals of this dispute need to change, and they're pointing to when the two sides met before Christmas and the government introduced the condition that they want to reform the railways to the extent that they have driver-only trains. And the RMT turned around and said, no, that's one of our red lines. Absolutely not. We're not getting involved in any sort of resolution if that's one of your conditions. So the fundamentals of this need to change according to the RMT. This is what Mick Lynch told us earlier.
Well, we want a resolution. We're ready and able to discuss with the companies and the government whenever they want to put that on. We're hearing that the Transport Secretary is saying that he's keen to convene talks. And if there's an invite, we'll be there today, tomorrow, or whenever it is that they want to get there. But there has to be a change. Well, they've put provisions and conditions into the documentation with the train operating companies that they know none of the railway unions can accept. They want to bring back driver-only operation. They want to get rid of guards right across the railway fleet and across every railway service. They want us to accept that as a principle. They know we can never do that. It wasn't in the documentation and the discussions before Christmas, and they chose one weekend when we thought we were working up towards a deal to put that in. So that undermined the talks and stopped them in their tracks.
So the RMT are saying that that is one of their red lines. The other way to look at it, of course, is that saying that it's one of your red lines therefore means that you're asking the other side to bend more if you're willing to rein back from that red line, if that makes sense at all. But certainly this is a dispute that's been going on for some time now, since last summer. This week is the biggest sort of almost continuous period of industrial action, given this is a 48-hour strike, and then there's another one on Friday, and then on Thursday you've got ASLEF, who effectively represent the train drivers, also going on strike. So you're looking at severe disruption to the UK rail network throughout this week. Now, listening to the two sides this morning, the RMT do want to meet. The government sound like they want to meet as well. Tim Shuffler, the Network Rail Chief Executive, has said that he's confident of getting a resolution similar to that was put in place with another union, the TSSA, the Transport Salaried Staff Association, before Christmas. So it sounds like the two sides are communicating and are willing to get back around the table, but that doesn't necessarily mean that there's going to be a resolution. There's still some gap between the two sides on the fundamentals, as we've just mentioned.
Yeah, indeed. OK, Paul, for now, thank you. Well, let's see what effect it's actually having if you're trying to get anywhere today. Let's talk to our West Midlands reporter, Jack Carson, who's at Birmingham New Street for us. Afternoon to you, Jack. I mean, have things pretty much ground to a halt there?
Essentially, there are some local train services running here. They've been running from 7 a.m. this morning and aren't going to run after 7 o'clock tonight. So it's some very minor and local services, things like Lichfield, Trent Valley to Birmingham New Street and Birmingham New Street to Wolverhampton. You can get 2 trains per hour on the Northampton to London Euston route, but apart from that, a lot of the other longer distance journeys run by the operating companies like Avanti West Coast, things like Cross Country as well, they actually stopped selling tickets for the trains because of the disruption that was expected, and said to people to only travel if absolutely necessary. So you can have an idea of, as millions of people head back to work after Christmas now for the first time, they are going to be experiencing some severe disruption if they try to get anywhere by rail. In terms of what effect that has had on other public transport around the city, speaking to one person earlier, they had to get the tram this morning. It took them 40 extra minutes to get into work, and they said the trams were absolutely rammed. They even had a police presence on them to make sure that everybody on those trams was safer because of how many more people were using them. Buses as well have been busy, but we know the government has also introduced a scheme to subsidise bus travel to only £2 for a single ticket, so lots of people opting for the bus in the wake of this industrial action. In terms of where this could end, and certainly between the RMT and Network Rail, we know that the RMT members rejected that pay rise offer from Network Rail. They said that was their final and best offer. It was a 5% backdated pay rise for 2022 and a 4% pay rise for 2023. That went to the RMT members. 55% of them said no. So it looks like there's still going to have to be a negotiation between those two, as well as other train operating companies, if there is going to be an end to this disruption.
Look, as it goes on, Jack, I mean, you said you've been talking to a few people there today. What's the sense from them? Are they fed up with how this is going, or is there still some solidarity with the strikers?
Well, I think they're annoyed with how much disruption this is maybe causing to their lives, but actually, they're in their view, the way to stop this disruption is for the train operating companies and for the government to give the RMT the offer that they want. That's the way that many people here in Birmingham are saying that they can end this disruption. They are quite sympathetic to their cause. Obviously, they understand and they don't like the fact that it's disrupting their lives, but they're behind the RMT. The majority of people here that I've been speaking to, there actually hasn't really been a specific amount, a specific pay rise that the RMT have asked for, but they just say they want the government to come back to the negotiation table. They're ready. They want the government to. Mark Harper this morning saying get off the picket line, come to the table. So maybe there might be a deal worked out soon.
OK, Jack, thanks very much indeed. I'd love to know your thoughts on that, because it's fascinating. We heard the same from Jeff Moody yesterday, didn't we, where in Barnstable, where there are going to be no trains at all this coming week, but saying, well, people were still there's quite a lot of support still for the unions in all of that. What do you think? GBViews at gbnews.uk. I'd love to hear your views at whichever side of the coin you represent. Would be really good to hear your thoughts on that. Well, it's a new year, new strikes, obviously, as a result, but for the Prime Minister, it is going to be a difficult 2023. He's facing challenges on multiple fronts. Let's have a look at the key ones. And, of course, strike action is top of the list in a way. The Prime Minister will be conscious that he has to stop the constant strike action and avoid the possibility of a general strike as the pressure continues to grow on him. A huge problem is, of course, a migrant crisis. How is he going to get a hold of that issue and stop people crossing the channel? The war in Ukraine, well, we say rumbles on. I mean, it's more than rumbling on if you're there. It's absolutely devastating. Britain pledged to back Ukraine for as long as is necessary. However, the threat of Russia regrouping and launching a new attack on Kyiv would present a huge test for the international community. If that wasn't enough, the NHS is representing challenges for the Prime Minister, with waiting lists at a record high and staff shortages, which have been, of course, exacerbated because of further strike action as well. And then on top of all of that, rising levels of inflation. Getting the economy under control is crucial to the Prime Minister in order to restore the reputation of his party. And finally, amidst all of that, and they're all interlinked in a way, energy prices. The government support for huge energy bills is due to end for businesses in April. In fact, for a lot of us in April, I think the Prime Minister is going to have to find an alternative plan to make sure that we can all survive. Let's talk to our political reporter, Olivia Utley, who's here in the studio. Good to see you. Heck, where to start on all of this? Can we talk, because I think it's almost the most obscure of them all, can we start with Ukraine? Because that is the one that is most of all out of our hands, I think, but it influences some of the others. We're continuing to provide support, but how long can we go on doing that for?
Yes, Boris Johnson's administration were very keen to be the global leaders in the fight back against Russia and acted accordingly, giving out packages of support month after month. Rishi Sunak's government has essentially followed in their footsteps so far, but it's being reported that Rishi Sunak is getting a little bit more cautious about that. Before Christmas, it was suggested the government had a Goldman Sachs-style dashboard, although Number 10 refuted that, to monitor where money was going and how it was being spent, etc. And obviously, there is some political pressure on Rishi Sunak not to just keep on giving out packages of support when there are so many people in the UK suffering from the cost of living crisis. On the other hand, obviously, supporting Ukraine as far as we're able to is, well, A, the right thing to do, but also B, Rishi Sunak will be very aware that to show that Britain can be a global leader outside of the EU, carrying on in the way that Boris Johnson's government did might be the best solution. At the same time, of course, what's happening in Ukraine ties into our energy prices, and which ties into inflation, so we're getting it all in there. And Rishi Sunak is obviously under huge pressure to bring down inflation. There were a few hopeful signs at the end of last year. Inflation was rising a little bit slower than expected in November and December. But unless he can get a grip on those inflation figures pretty quickly, then you've got the cost of living crisis just playing out under his eye and more strikes ahead.
Yeah. I mean, it's an absolute nightmare. It's almost like a perfect storm, isn't it? When it comes to the energy prices, I mean, obviously, as you said, so much is dependent on on what's happening in Ukraine. The wholesale gas prices are supposedly falling at the moment, not that we're seeing much of an impact of that in our pockets. But we've got the support measures in place, which means we're paying, on average, as individuals, as households, no more than £2,500. That's on average. It varies a great deal. Don't think that's the most you'll ever pay. However, that's costing the government an awful lot of money, and it's not going to carry on forever.
Absolutely. The government can't afford for it to carry on forever, but people will see a huge rise in their monthly outgoings, which could again lead to public sector workers demanding more money if they don't get it, going on strike. So we get back round to the same problem. And of course, the financial lever that the government has to try and alleviate the inflation crisis is to keep raising interest rates. But obviously, if the Bank of England raises interest rates too quickly, you could end up in a situation, the Times is already reporting this morning, that house prices are going to absolutely crash in 2023. And the last thing the government wants is the country getting into negative equity. So there are a lot of very difficult balances that the Prime Minister and the government are going to have to strike going into this year.
In the meantime, if you talk about inflation rates being affected by interest rates, is there anything else the government can do that we know of that can affect inflation?
Well, giving the RMT and nurses the sort of pay rises that they're looking for would probably raise inflation. At least that's what the government is telling us. So trying to sort of keep that down is one way that they can try and help. I mean, the sort of measures that they're employing at the moment to try and get a grip on rising inflation are things like advising people to, turn down their heating when they go out, which just sort of shows, useful though that is, it does just sort of show the extent to which this problem is out of our hands. As you say, oil prices are set to start to go down, but if it's a bit up in the air. We can't just rely on what Putin's going to do in Ukraine. The government's obviously hoping that we get a sort of mild winter going forwards, because the cold snap in the end of last year obviously massively uprated people's energy bills, and the government was footing that bill. So we're hoping for a mild winter ahead, but also a windy winter, because we're pretty reliant on wind power.
All of that all ties in together, right? The inflation strikes, Ukraine, cost of living crisis, all lumps in together. It affects the NHS in terms of the strikes, but the NHS is almost a separate problem in and of itself, isn't it? Because of its inefficiencies, 160 billion plus that it's going to cost us this year. The NHS, whether nurses and people were striking or not, is going to have to be looked at, and that's going to be some very hard decision-making, isn't it? Yeah,
I mean, the NHS is definitely in crisis. We say this every winter, but this time it does seem to be worse than usual. What the government is starting to brief now are the statistics on just how much money has been put into the NHS, and actually the NHS is now on the very high end of the best-funded health services in the OECD. We've also got stats this morning on the higher numbers of doctors and nurses working in the NHS than pre-pandemic, going up by sort of 17% over the last 3 years. So the government is starting to push back against the line that the problem is that the NHS is underfunded.
So we should be seeing an improvement.
So we should be seeing an improvement, but as we know, we're not. We now have some of the worst outcomes for cancer care, for example, in the whole of the OECD, even though it is better funded. That means that the government has got to start looking at the inefficiencies, as you say, the whole model of the way the NHS is funded. But there's not a huge amount of political incentive to do that, because any serious reform of the NHS, we wouldn't start to see the results until long after this government is out of power.
Very fair point. Olivia, thank you very much. Would you want to be a politician?
No, thank you.
No, not at the minute.
Comment from the sideline.
No, absolutely. If you've got any great ideas for that, gbviews@gbnews.uk. And I say that in all seriousness, actually, because often you come up with these little snippets of ideas which you think the politicians really should take notice of. Coming up for you, though, as the NHS faces a winter crisis, because COVID and flu continues to soar across the country, we're going to be talking more about the challenges facing government in dealing with pressure that the NHS is under.
I'm Camilla Tominey. Join me on GB News on Sunday mornings for a politics show with personality on TV, radio and online. GB News, the People's Channel, Britain's news channel.
We are GB News, and we'd like to say thank you to each and every one of you for bringing us your conversations, for helping our great nation find its voice. We are here for you on radio, television, and online, across England, Scotland, Wales, and Northern Ireland.
It's not the BBC, you actually get your facts right.
We are proud to be GB News, the People's Channel, Britain's news channel.
Monday to Thursday, 9 p.m. till 11 p.m. Join me, Dan Wootton. I'll bring you the sharpest takes and hottest debates.
Do you not believe in prisons? I don't believe in prisons.
I'm completely stunned. I guarantee you there'll be no spin, no bias, no censorship.
I actually was personally quite offended by it.
And no reason to go to bed.
So I guess they've always been quite woke.
That's Dan Wootton tonight on TV, radio and online. Monday to Thursday from 9 p.m. till 11 p.m. on GB News. The People's Channel, Britain's news channel.
Hello there, it's Eamon Holmes here from Breakfast on GB News. We're not just on your television and your screens, you know.
We're on DAB plus digital radio, so you can listen to your favourite shows on the move.
If you've not yet listened to GB News Radio, it's very simple. We're on your radio player and TuneIn apps, on your smart speaker, phone or tablet, or online at gbnews.uk.
Take us with you wherever you go. GB News Radio.
You never have to miss a moment of the People's Channel.
Join me every Sunday at 6 p.m. for Gloria Meets. In exclusive interviews, I'll be finding out who our politicians really are and what they really think.
It's something that you would never want anyone to suffer.
I didn't know what channels there were. I didn't think I'd be believed.
I must have weighed about 7 stone and I'm 5'8".
My instincts was to sort of cover this up. I mean, clearly that was a mistake.
Join me every Sunday at 6 p.m. on GB News, the People's Channel, Britain's news channel.
It's 12:26. Now, the government's being warned that pressure on the NHS shows little sign of relenting as ministers come under increasing pressure to respond to the crisis. Top medics have described the current situation as unbearable and intolerable as both the Prime Minister and the Health Secretary face calls to address growing concerns about the state of emergency care in the NHS. Well, let's go to West Hertfordshire Ambulance Station and speak to our national reporter, Theo Chikomba. And the big concern here, Theo, is as the crisis really takes a grip and as the NHS, and particularly in emergency care, is failing, it's very difficult to know what actually the government needs to do to try to get it back on track.
That's right. We have heard about winter pressures for years now. It's not the first time, but this year we've heard from health bosses, they're saying this year is in comparison to what we saw at the beginning of the pandemic. That time when people were coming in with COVID cases, staying in hospital for long periods of time, but also this year with flu cases and people coming in with other things as well. We've heard from some doctors actually who are saying patients are coming in, they're sitting or standing in corridors for hours upon hours waiting to be treated. And similarly here at Ambulance Trust, they have, particularly here in the east of England, they've said they've declared a business continuity incident for the second time in a number of weeks because they're simply dealing with so many 999 calls and also hospital handover delays. So it's difficult to say what can be done right now, but what we've heard from health professionals over the last few weeks is to do with how many people are at work. That's particularly with their rotas, but of course pay and people leaving and going to do other things as well.
OK, Theo, for now, thanks very much indeed. I mean, it is a real concern, isn't it? And it's exacerbated by everything that's going on. I mean, particularly, as you say, the COVID and the flu and so many of us with this sort of super cold that's doing the rounds as well. In case of if you can just stay at home and try and get better, try to do it. But, of course, some people are in a much more serious condition than that. Loads of you getting in touch today. Thank you very much indeed. GBViews at gbnews.uk. And on the NHS, Davey, afternoon Davey, says what needs doing is to get rid of management jobs, which includes outdated and quango jobs. I think it's a fair point to say I think management structure needs to be looked at in all of this. Also on the NHS, Stephen's been in touch. Afternoon to you. He says the NHS gets about £160 billion a year. Social care, which falls under slightly different budgets. It's a slightly different issue. But social care should get 100% of the funding needed first, then A&E should get 100% of the funding required. Once you get the basics right, there's a chance of providing a decent healthcare system. And I understand where you're coming from, Stephen. I think the problem with that is, though, it's how much of that money is being wasted. I mean, we've got to save on some of the money somewhere, haven't we? Not to reduce levels of care, but to make things more efficient, I think. Should social care get money before A&E care? It's a difficult one. If you've got a view on that, get in touch. Liz, afternoon, Liz. It says the social care system is just broken. As a person working in the system and purchasing care beds for clients, I can say the privatisation of care homes and supported living facilities has encouraged enormous hemorrhage of financial resources from the sector. And again, I mean, you're not the first person to say that, Liz. Do we need to look at all this again? Are we hitting a point where everything should be renationalised, pretty much? The problem with nationalising, of course, is that it costs a lot of money because you've got to buy it. You can't just take it back, you've got to buy it back. So it becomes very expensive. But a lot of people say social care should be nationalised and fall more under the NHS umbrella. Keep your thoughts coming through. GBViews at gbnews.uk. I'm going to get a little rest from my voice in a second. But coming up, as the football great Pele is laid to rest in Sao Paulo, we're going to be talking about his legacy with a Brazilian sports journalist. First, though, Tamsin has your news update.
Stephen, thanks very much. It's 12:30. Here are the headlines. Train passengers are being warned of significant disruption this week as over 40,000 rail workers stage fresh strikes. Members of the RMT union at Network Rail and 14 train operators will walk out for 48 hours from today and again on Friday, whilst drivers in the ASLEF union will strike on Thursday. This latest strike action is part of a long-running dispute over pay, jobs and conditions, which RMT General Secretary Mick Lynch told us is vital for the future of the industry.
Up to the government now to show us that they mean business and that they want to facilitate some talks, rather than undermining them as we believe they did before Christmas by putting provisions in that they know none of the railway unions can accept. So if we can get some realistic talks with some proper proposals and progressive talks, we'll work with all the parties to get that on.
But Transport Secretary Mark Harper says it's time for the unions to get off the picket line and round the negotiating table.
Government's going to continue to work really hard to try and help bring the two sides together to get this resolved. I know how frustrating this is for commuters, and the danger is it puts people off using the railways, which is a bit of self-harm on the part of the rail unions that haven't settled this dispute. What I think the government can do is make sure there's a fair and reasonable offer on the table, which there is, facilitate those negotiations between employers and trade unions, and try and make sure we get this dispute resolved for the travelling public.
The government insists it's doing everything possible to increase hospital capacity, as top medics describe the current situation as unbearable. More than a dozen NHS trusts and ambulance services declared critical incidents over the festive period. The Royal College of Emergency Medicine says somewhere between 300 to 500 people are dying each week as a result of delays in urgent care. The government says it's given the NHS and social care sector an additional £14 billion over the next 2 years. 2 British citizens were among 4 people killed in a mid-air crash between 2 helicopters in Australia yesterday. Diane and Ron Hughes, aged 57 and 65, were on holiday in the country when the accident happened in Australia's Gold Coast region. 3 others were left critically injured. TV, online and DAB+ radio, this is GB News.
Monday to Thursday nights on GB News. At 6, it's Dubes & Co. 7 o'clock, Farage. At 8, join Mark Stein. And at 9, Dan Wootton Tonight, followed by Headliners. On TV, radio and online. This is GB News.
We are GB News, the People's Channel.
Why not take us home with you by visiting the GB News shop at gbnews.store? You'll find all the official merchandise, a really good present actually for yourself, your friends or your family.
We ship across the UK mainland at no extra cost. GB News, the People's Channel.
Here on GB News Live, we'll be keeping you in the picture, finding out what's happening across the country and finding out why it matters to you. We'll have the facts fast with our team of reporters and specialist correspondents. Wherever it's happening, we'll be there from 12 noon on TV, radio and online. GB News, the People's Channel, Britain's news channel.
Monday to Thursday on GB News, it's Bev Turner Today from 10 a.m. We're going to be here for you, our GB News family, to keep you up to date, but also make you smile.
There's a guy who went from puberty to adultery.
And I can't wait to bring a few of my own opinions.
I have no time for cultural totalitarianism.
We'll engage in passionate, but always polite debate, with your thoughts and opinions at the centre of it all. Only on GB News, the People's Channel, Britain's news channel.
Hi there, it's Stephen and Anne.
At breakfast from 6 a.m, you'll always be caught up with everything you need to know, the latest headlines, opinions and debates.
We'll bring you the good news and the bad, but most of all, we're here for you.
Remember, send in your views and let us know what you would like us to talk about.
That's because we're your news channel. And every morning at 6 a.m, it's breakfast on GB News.
It's 12:35. Very good afternoon to you. Now, a UK chief medical advisor has warned adults to stay at home if you're feeling unwell. Well, I can't say I've heeded that advice. Mind you, I'm not feeling a lot better. So there you go. So that's on the plus side. Or perhaps wear a face covering if you're going outside to help minimise the spread of illness. Professor Susan Hopkins, who's chief medical advisor at the UK Health Security Agency, has also said that adults shouldn't visit vulnerable people unless it's urgent if you feel unwell. All this coming, of course, as the government is being warned that pressure on the NHS shows little sign of relenting as ministers come under increased pressure to respond to, well, we're calling it the crisis. It's like 100 crises rolled into one, isn't it? Let's speak to NHS GP David Lloyd. David, good to see you. Bear with me, because I'm struggling a little bit in all of this. I'm a lot better than I have been.
Yeah.
I mean, but the problem is, when it comes to pressures on the NHS, that so many people, I mean, huge swathes of the population are feeling really unwell at the moment.
Yes, that's right. I'm afraid it's another consequence of COVID, in that the usual epidemics we get every winter have all come at once and all come much earlier than usual. So we had Group A strep, we had bronchiolitis, we had COVID, and we've got the flu. So four wide illnesses that affect an awful lot of people have all arrived at once. And of course, everybody gets very frightened because everybody reads about it in the news. And so we get a lot of people wanting to see their doctor, to see their GP or go to A&E, who might not be very ill at all. And then in amongst that, we have some people who are very, very ill indeed. So yes, it's an interesting time.
What pressure does this put on you as a GP?
Well, I start my day at 8 o'clock in the morning and I finish it at 8 o'clock at night. And that'll go on for the next few weeks and until we can get back to some sort of normality. So that's how it affects me personally. But it is very tiring. And that's not just me, it's everybody who's working in my practice. It's everybody who's working around the NHS. GPs have seen more patients face to face than they've ever done in the past, despite the criticism that we're seeing people virtually or not seeing people at all. We are seeing an awful lot of people face to face. We are dealing with an awful lot on the telephones. And yes, we're doing a bit on video too, but really that was the thing that we used during COVID. But now everybody wants to see us face to face. And honestly, it's much quicker and easier if you do see them face to face anyway. But yes, and then of course, we have a very high sickness rate because doctors and nurses are going off sick because they're coming into contact with all this illness too. So yes, it's a perfect storm, but a predictable perfect storm.
It raises questions about how the whole NHS structure doesn't it, in all of this? And I don't know if you have a view that you are willing to share on what needs to be done with the NHS, but a lot of people looking at it now saying, well, you cannot just plough more money into this. As we're hearing, it's one of the best funded health services in the world, actually, but our results are just not good enough. Do we need to look at a proper restructure, even though that would actually take years to complete?
Well, I think we're experts at restructuring. I think every new Minister of Health that comes along tries to restructure us again in a new way. So we're used to people trying to change us and changing the ways, and obviously we'll change whatever the bosses say. But I should caution you, we've got to look at the world in general, and we've got to look at UK PLC, if you like. And the one major advantage we have when we're competing on the world marketplace is that we do have a national health service for everybody. And that means that companies that are trying to compete in the rest of the world don't have the added costs of paying for healthcare like they do in the USA. And in the USA, they consume 19% of their GDP on health. So if you're looking to the USA for a model that might replace the NHS, then I wouldn't go there, really. And likewise, the insurance systems in Europe are very complicated, leading to lots of duplication. So we do have a remarkably efficient health service, and we should be looking to improve it. And by doing that, we'll make the UK more competitive.
Oh, well, that's not an urgent call coming through for you. Look,
No, I'll put it down. I'm sorry, I didn't realise.
No, don't you worry. Don't you worry. I mean, you're someone who really needs to be on call, whatever you're doing. Look, within all of this, I mean, I certainly noticed a few years ago there seemed to be a period of quite joined-up thinking within the NHS. Someone like me, for example, as a type 1 diabetic, was seeing, getting everything done in an annual check during one day, everything checked out.
Yes.
It was a very efficient system. We seem to have split things off quite a lot more, getting bloods taken at the GP surgery, seeing a specialist in the hospital for one issue, seeing another specialist on another day to have retinal checks or whatever it may be. We seem to have lost some of that cohesion.
I can't help but agree with you, I'm afraid. I think we're recovering from that terrible shock of COVID. We're looking at new ways of doing things. We're having to cope with a smaller budget in the NHS to pay for doctors and nurses, because every year the bill for new drugs and new medication goes up and up and up. You're speaking as a diabetic. I'm sure you're aware of the Kardashians and their Ozempic cry. We have a new wonder drug called Ozempic for our type 2 diabetics. It's absolutely amazing, and it's a once-weekly injection. But it costs hundreds of pounds more than the old drugs we used to use for diabetes. So we're using 19% of our GDP, of our health budget now on health, when I first started, it was only 5%. So we've got extraordinary pressures, and somebody very clever has got to try and think of new ways of doing things. My present bandwagon is about training UK doctors and nurses, because forever the NHS have stolen nurses and doctors from poorer countries. And I really think that that's not the right thing that we should be doing now. We should be home-growing our doctors and nurses. We've got the medical schools. We just need the OK to go and start taking in UK graduates rather than the foreign graduates they're being forced to take at the moment because they haven't got the money to pay for anything else. We've got a wonderful education system, and we should be using that to train up our own doctors and nurses.
I think a lot of people would agree with you. Dr. Lloyd, very good to talk to you this afternoon. Thank you.
Thank you.
Now, let's turn our attention to Brazil, should we, where footballing legend Pele's funeral is taking place today. Thousands upon thousands of mourners paying their respects. The three-time World Cup winner died at the age of 82. His coffin, currently at the stadium of his former club Santos, is going to be carried through the streets of Sao Paulo before a private family burial. Well, let's see if we can talk now to Brazilian journalist Lucas Liroth. Good to see you this afternoon. I mean, clearly, it seems like the whole country is in a state of mourning.
Yes, of course. The whole country is mourning, sadness today. And these last 5 days were very hard for us all. We celebrated the New Year's evening, but we all are sad, and we remember Pele not as the older people from other countries do. In the entire world, Pele is remembered like an athlete, like a footballer, like a football genius. But for us Brazilians, he is a national hero. He's like our main generals and pharaohs. He's part of our history and will not be. His death will not be overcome so easily. We are very sad. We mourn his death, and of course, in Santos, in the city of the São Paulo state, the situation is very intense. Thousands of people in the streets, but on the whole country, we have people crying his death, and not only today. Just the last few days and the coming days will be very hard for us all in Brazil.
How important has it been for those who've been able to do it to get to the Santos Stadium and to be able to see Pele lying in state, in effect, to be able to pay their respects?
Well, Pele is an icon for not only for Santos, but for the entire country. And we now see his lying, his dead, and that's hard. That's very, very sad, very complicated for Brazilians to accept this fact. Because you'll see, we are in a generation in which people did not see him playing, but we all are very sad with this situation. But who's Pele for us Brazilians? My father also did not see Pele. My grandfather saw, but my father and I and my sons, we all are deeply mourning Pele because he's an icon of Brazilian history. I'm not from Santos. I've never been Santos. I'm from Rio de Janeiro, and here in Rio de Janeiro, people is attending the funeral via TV. People are coming together, family and friends, to see the funeral. And Santos, of course, thousands of people. Situation is much more important for them because Santos is the temple of football. He made it.
Yeah, absolutely. Look, Lucas Liruth, it's very good to talk to you on what is, clearly a difficult day for you and indeed for all the people in Brazil. Thank you very much indeed. Now, Prince Harry, in his latest interview, has said that he would like to have his father and brother back. Now, this was in a trailer for an interview ahead of the release of his upcoming memoirs, Spare. He's claimed the pair have shown absolutely no willingness to reconcile and also said he was betrayed. And so far, Buckingham Palace, no surprise, has declined to comment. Well, our royal reporter, Cameron Walker, is here in the studio. Cameron, afternoon to you. I think a lot of people will be like me, surely, and thinking, how can he want to reconcile when he's openly done so much damage to the family?
And also, what else is there to say? I mean, what we're getting from these two trailers which have been released from both CBS in the United States and ITV here in the United Kingdom is everything he's already said in the Netflix documentary series last month, what he's already said in Oprah in 2021, where he accuses the palace of leaking, of planting stories to make himself and his wife Meghan look like the villains and to make Prince William and the King perhaps look better. Now, clearly, Buckingham Palace, as you said, has not commented on this. I think it's perhaps some pros and cons to that. It stops the palace from getting into a Hollywood-style, like, tit-for-tat argument. Perhaps doesn't cheapen the monarchy either. But we're only getting one side of the story, aren't we, Stephen? And that is Prince Harry's version of the truth.
Is there a benefit to that, though? As you say, there's no tit for tat as far as that goes. But it also means, doesn't it? And then maybe this is my perception, and if you've got a different one, I'd love to hear your thoughts. But I'm certainly getting the idea that Prince Harry's running out of steam a little bit with this, and the more he says, the less we're listening.
I think he sounds like a bit of a broken record, perhaps, and from the Palace's perspective, they haven't commented on any of this. They didn't comment on the Netflix documentary series. They are so far not commenting on this, but you just have to look at the latest approval ratings. The latest YouGov poll suggests that Prince Harry and Meghan's popularity has plummeted in the United Kingdom, whereas the other members of the royal family have stayed pretty much the same, and that is with the palace's strategy of never complain, never explain, something which Harry actually mentions in this trailer for the interview, saying that that's the palace motto, but it didn't perhaps apply to him and his wife. But from the palace's perspective, it's very much working.
What about in the United States? Because obviously that's where they're making their money and things. And there was talk after the Netflix docuseries that perhaps their popularity wasn't as strong as they were hoping.
Yeah, he's doing an interview with Anderson Cooper on CBS. It's understood that perhaps Harry trusted Anderson Cooper to do that interview because he's done a lot of campaigning for mental health, something Prince Harry has very much championed himself in the past. From speaking to people in the United States, I was in Boston with the Prince and Princess of Wales for their Earthshot Prize, and I got the impression that they too are now starting to grow tired of Harry and Meghan's arguments that they have put forward, because they sound like a bit of a broken record, and there's lots of hot air, as it were, but there's no specific allegations or specific evidence to back anything they have said up, and that's proving a real challenge for Harry and Meghan. And if it does get to the point where them talking about their experience as working members of the royal family becomes boring to the US public, it therefore is not going to sell, and they are relying on capitalising as members of the royal family with the book, with the Netflix documentary series, with more future books. We've seen rumours of that in the papers over the next few days. They're going to really struggle because,
I mean, presumably, these series of interviews are about Harry pushing the book, which is why it's an interview with Harry and not Meghan, or not both of them. One thing which is interesting is we're hearing more. Meghan did seem to dominate the Netflix thing a little bit. Obviously, this is a different perspective, at least.
Yeah, this is very much Prince Harry's truth, and I think the book, at least, is going to go into a lot of detail about his experience in childhood. The blurb talks about him walking behind his mother's coffin in 1997 and the experience that's had on both him and Prince William. There was, in the papers over the weekend, I think it was the Sunday Times, suggested that Prince Harry's going to go pretty hard on his brother, Prince William, but will perhaps leave King Charles alone a bit more than that.
But yet he says he wants to reconcile.
Yeah, and that's the problem. You can't really reconcile if you're going to be slamming members of your own family. I think King Charles's perspective is he's always loved his sons. He's had several olive branches reaching out. We saw that in his accession message to our people following the death of his mother, the Queen. He said he supports Harry and Meghan with their choice to have a new life abroad, and yet we're still getting this book, we are still getting this Netflix documentary series, and we've got these two interviews promoting this book, which will be airing on Sunday.
OK. Cameron, for now, thank you very much. This isn't going to go away anytime soon, is it? No. Well, it keeps us in business, I think, a little bit. If you've got a view on that, we'd love to hear from you. gbviews@gbnews.uk. On the NHS, Tony's been in touch. Afternoon, Tony. He says, our not fit for purpose NHS is already more than adequately funded. Instead of our useless PM's answer to everything, as in throw in more money. Well, a lot of people would agree throwing in more money is not actually going to be the solution here. £160 billion plus this coming year is going to cost. It's a lot of money. A lot of people saying it's middle management that needs to go. I don't know. We'll have to see. Julia says the NHS does not need more funding. It needs CEOs who are capable of running a large business like a hospital. Layers of pen pushers need to go, and nurses need to concentrate on looking after patients and not being another layer of pen pushers. Sounds like common sense in a way, doesn't it? Michael says the real concern is the appalling quality of NHS management. Here we go again. Every year gets the same old story from this useless organisation. More cash will solve nothing while the useless management remains. Problem is, the management is... I mean, it evolves, it changes. People get jobs and lose jobs every single year, doesn't it? So it's not the individual managers in a sense. It's what the role is that perhaps need to change. Rob says, crisis? What crisis? My dad had a heart problem at the weekend. He found himself in Bournemouth's high dependency unit 50 miles away within 50 minutes, working like clockwork down there. Well, what a relief. What a relief. We had a message from someone yesterday whose dad had a heart issue on lunchtime, New Year's Eve, called 111. They said a doctor would be sent out within 6 hours, and nothing had happened. And his father died yesterday morning at 7 o'clock without a doctor ever turning up. So it sounds like you're one of the lucky ones there, but I'm glad you're one of the lucky ones. Neil says, open the Nightingale hospitals manned by military doctors and nurses. Well, maybe it's going to come to that. You never know. I don't know how much of them still exist and what's available there. Of course, that's more pressure then on the armed forces, isn't it? Which is problematic. Clive says people have lost faith in their GPs, so people go straight to A&E. Therefore, A&E are now required to carry out primary and secondary care, which is a huge problem. Losing faith in your GP? I don't know. Just the fact you can't get in. Maybe that's what it equates to. Donna, afternoon Donna, says it's not COVID, it's the winter flu like we've had for hundreds of years. This country is embarrassing. It's much worse, though, because of COVID. That's the issue, I think, because our immune systems are reduced as a result of several years of lockdown. And Christopher says, Dear Stephen, welcome back. Oh, thank you. Everyone can see the NHS is overstaffed by high-paid non-job managers and layers of unnecessary management. Not one government over decades have had the guts to reform this from the top down. Perhaps a fair point. Keep your thoughts coming through, gbviews at gbnews.uk. I'm with you till 3 this afternoon, bringing you all the very latest, of course. First, so let's have a look at the weather for you.
Hello, I'm Aidan McGivern from the Met Office. Most of us will see outbreaks of rain today. It will also be windy and it will be mild. The wind's coming from the southwest at the moment, bringing a lot of mild air with them, but also bringing an awful lot of cloud, outbreaks of rain, a couple of weather fronts to watch out for. One has already pushed through, bringing a spell of rain earlier, but the next weather front is moving in for the afternoon, and that will pep up the rain once again. So some gaps in between the spells of rain, especially in the east and for northern Scotland, where it stays fairly cold, but it is turning milder here, so there are snow that we've seen eventually more confined to the higher tops of the mountains, and the rain replacing it. A lot of rain across the country, a strong wind, but that wind coming from the southwest, so it is going to be feeling mild, especially in the south. The rain, heavy at times as it moves through, could cause some issues for central and southern Scotland, particularly over higher parts, and it stays damp in the south as well through the evening and overnight. It's a windy night, but the winds, of course, since they're coming from the southwest, mean that it's going to be mild. Temperatures in many places in the double figures by dawn, just in the mid-single figures there for northern Scotland, where the rain eventually moves in overnight and then clears slowly through the morning. The rain also clearing the southern half of the UK, but in between there is a band of wetter weather for southern Scotland, for northern England and for Northern Ireland, that turning a bit more showery later in the day. And it's a mild day. Blustery, yes, but temperatures up at 14 Celsius in the south, 7 or 8 for Scotland and Northern Ireland. Some damp weather returning to Cornwall and Devon for a time during the afternoon and early evening, but that clears through. And then clear spells for many overnight on Wednesday night, showers in the north tending to fade away. Thursday looks like another showery day for many. Friday a little drier, but further rain or showers coming along for the weekend.
I'm Camilla Tominey. Join me on GB News on Sunday mornings for a politics show with personality.
On TV, radio and online.
GB News, the People's Channel.
Britain's news channel.
Every morning from 6 o'clock, we'll wake you up with GB News Breakfast with all the stories you didn't know from the night before.
So whether it's serious news, entertainment, or your own views from all over our great nation, we're here to kick off your day with a smile.
And the national media should be reflecting and reporting what's happening here. You will notice the northwestern accents.
Whether you're with us on TV, radio, or online, every morning, it's breakfast from 6 a.m. Hope you can join us.
We are GB News, right across the nation. You can get us on television, on radio, on digital. We're absolutely everywhere.
Amazing! You see, amazing! You remind me of me in the European Parliament.
But here's the most important bit. We are not part of the mainstream establishment. We think and speak just like you do. We are the People's Channel.
Magnificent. That's really, really thoughtful.
Come and join us on GB News, the People's News Channel.
My name's Tom Harwood and join me 9:30 a.m. every weekday for The Briefing, your one-stop shop for everything you need to know about what's going on in politics today.
I wonder if this is a deal that might need to be like the biscuits in this factory, twice baked.
Is there not an opportunity here to win out against the extremes?
Tom Harwood, GB News.
What are you going to do about it?
Things should have been done differently, and they certainly are being done differently.
Don't miss it. The Briefing with me, Tom Harwood, 9:30 Monday to Friday on GB News.
Join me, Nana Akue, Saturday and Sunday afternoons on GB News. Expect fiery debate and passionate discussion as me and my panel tackle some of the biggest topics hitting the headlines. It's a place for everyone's opinion. No one gets cancelled, but no one gets an easy ride.
Oh, she's on it today!
Be ready for conversations that are fierce, frank, and of course, fun. Every Saturday and Sunday afternoon from 4 p.m. on GB News, the People's Channel.
Very good afternoon to you. It's 1 o'clock. This is GB News Live. Here's what's coming up for you this afternoon. New year, new hope. Well, no such luck, as 2023 kicks off with a new batch of rail strikes. And there isn't an end in sight, I'm afraid, with the union boss Mick Lynch criticising the government on their handling of negotiations. Going to bring you the very latest. The NHS under pressure with rising COVID and flu cases crippling the healthcare system. A senior health boss says the pressure on staff is unbearable, and health officials warning that challenges could continue right through until Easter. And we're going to bring you the latest in the Harry and Meghan saga, with the Duke of Sussex claiming he wants his father and brother back just days before his memoir is published. He's given, again, some pretty blistering interviews, actually. We'll host a detailed discussion. And, of course, we want to hear from you, as always. Get in touch, gbviews@gbnews.uk. Before all of that, though, let's take you through the latest news headlines with Tamsin.
Good afternoon from the GB Newsroom. It's 2 minutes past 1. Train passengers are being warned of significant disruption this week as over 40,000 rail workers stage fresh strikes. Members of the RMT union at Network Rail and 14 train operators are walking out for 48 hours from today and then again on Friday, whilst drivers in the ASLEF union will strike on Thursday. It's part of the long-running dispute over pay, jobs and conditions, which RMT General Secretary Mick Lynch told us is vital for the future of the industry.
It's up to the government now to show us that they mean business and that they want to facilitate some talks, rather than undermining them, as we believe they did before Christmas, by putting provisions in that they know none of the railway unions can accept. So if we can get some realistic talks with some proper proposals and progressive talks, we'll work with all the parties to get that on.
Transport Secretary Mark Harper, however, says it's time for the unions to get off the picket line and round the negotiating table.
Government's going to continue to work really hard to try and help bring the two sides together to get this resolved. I know how frustrating this is for commuters, and the danger is it puts people off using the railways, which is a bit of self-harm on the part of the rail unions that haven't settled this dispute. What I think the government can do is make sure there's a fair and reasonable offer on the table, which there is, facilitate those negotiations between employers and trade unions, and try and make sure we get this dispute resolved for the travelling public.
It's also about the pressures in primary care and through GP services, through better use of other parts of the primary care system, notably pharmacies, so that people can have ready access to the right level of support. It's unhelpful, I think, when people say or imply that the only way you can get healthcare support is by seeing a GP. That's nonsense.
That was former Health Secretary Stephen Dorrell speaking there. The story about the government insisting it's doing everything possible to increase hospital capacity, as top medics describe the current situation as unbearable. More than a dozen NHS trusts and ambulance services declared critical incidents over the festive period. The Royal College of Emergency Medicine says somewhere between 300 to 500 people are dying each week as a result of delays in urgent care. The government says it's given the NHS and social care sector an additional £14 billion over the next 2 years. People travelling to England from China will not be forced to quarantine if they test positive for COVID on arrival. The government says the move is about collecting information due to the Beijing government refusing to share its own coronavirus data following a surge in case numbers there. However, testing will be optional for passengers landing at London Heathrow. Under new government measures, people flying to England from China will be required to show a negative COVID test before boarding the plane. A Conservative MP has told GB News she wears a stab-proof jacket for protection when meeting local voters. Virginia Crosby warned of the scale of abuse politicians are facing. She says she's faced threats before, adding things have not improved for MPs. Her peer, Sir David Amess, was fatally stabbed during a constituency surgery in October 2021, whilst Labour MP Joe Cox was murdered in 2016. Low-income households will receive £900 cash support this spring to help with the cost of living crisis. The government says the money will go directly to bank accounts in 3 separate payments. But campaigners argue support for the most vulnerable has not increased on what was announced last year, despite rising costs. 8 million people will be eligible, including those on universal credit, pension credit and tax credits. 2 British citizens are among 4 people killed in a mid-air crash between 2 helicopters in Australia yesterday. Diane and Ron Hughes, aged 57 and 65, from Merseyside, were on holiday when the accident happened in Australia's Gold Coast region. 3 others were left critically injured. Queensland police say the initial investigations indicate the collision occurred when one helicopter was taking off and the other was landing. Russia says 63 of its soldiers have been killed in a Ukrainian attack in the occupied region of Donetsk on New Year's Eve. Ukraine initially claimed it killed 400 Russian fighters, a claim Russia has called an exaggeration. The attack hit temporary barracks in the eastern Ukrainian city of Makivka, where Russian forces have been stationed. An NFL player is in a critical condition after suffering a cardiac arrest during a game in Cincinnati. The Buffalo Bills club has confirmed Damar Hamlin collapsed on the field after a tackle in the first quarter against the Cincinnati Bengals. The 24-year-old is currently in a critical condition in hospital. The game was postponed following the incident. Hundreds of thousands of fans have gathered to pay their respects to Brazilian footballing legend Pele, who's due to be buried today. Newly sworn-in Brazilian President Lula has joined 150,000 people who file past a coffin at the grounds of Pele's former club, Santos. The 3-time World Cup winner lost his battle with cancer last Thursday. He was 82. This is GB News. We'll bring you more news as it happens. Now, though, it's back to Stephen.
Tamsin, thank you. It's 8 minutes past 1. Now, today is the first day of the new year that rail workers have started strike action once again. 40,000 RMT members have walked out in a 48-hour strike, and they're set to continue into the week with more planned. Now, the dispute, as you will be aware, is down to pay and working conditions. Let's talk to our reporter, Paul Hawkins, who's at Euston Station for us. Presumably, Paul, there's not a great deal happening there in terms of rail movement today.
Yeah, absolutely. Rail movement and, frankly, passenger movement. I mean, very few passengers in and around the station, to be honest. Only 20% of trains running in and out of Euston. And that's basically the picture across most of the country. And in fact, even the picket line that was here this morning has disappeared. Mick Lynch, the RMT boss, was here earlier on. Mark Harper, the Transport Secretary, saying he needed to get off the picket line and get around the negotiating table. Well, now there's no picket line here. He can do that. And in fact, that's been the kind of mood music this morning from both sides. The RMT and the on one side, and then the rail delivery group, which represents the rail franchises and Network Rail on the other side, that both sides seem to want to get around the table. Yes, they've both been criticising each other in terms of the negotiations to this date, but they do seem to want to get around the negotiating table. The problem is, what kind of conversation are they going to have when they do get around that table? Because the fundamentals are, on pay, there is no movement, although there could be some negotiation there around pay, but the fundamentals are on things like working conditions and the way the railways are run, which during the last round of negotiations just before Christmas, the government threw in a condition that it wanted driver-only trains, just one of a number of conditions that they introduced, that the RMT said, no, absolutely not. That's one of our red lines. We're not going to cross it. So there are some fundamentals that need to change with the conversation, but generally speaking, as we can hear now from Mick Lynch, the boss of the RMT, they do want to get back around the negotiating table.
Well, we want a resolution. We're ready and able to discuss with the companies and the government whenever they want to put that on. We're hearing that the Transport Secretary is saying that he's keen to convene talks. And if there's an invite, we'll be there today, tomorrow, or whenever it is that they want to get there. But there has to be a change. We've been hearing the same stuff for 6 months or more, that they want to facilitate a settlement. Well, they've got to prove that now. They've got to change the equation that's being put to us in those talks. And we will look forward to that if that comes true.
So, Stephen, this is a significant strike. I know that this strike action has been going on for some time, since midsummer, but this week there's a 48-hour strike starting today, another 48-hour strike starting on Friday, and on Thursday, ASLEF, they're the union that represent train drivers, will also be striking. So, in effect, a large part of the UK's train network will be paralysed for the week. People have adjusted to it. I mean, they had adjusted to it anyway with the working from home phenomenon that came about because of COVID, but they're adjusting to it even more now, to the extent that you tell people there's a train strike on and they kind of go, yeah, okay, we're getting used to it now. And people around here, one guy I spoke to said he's had a bit of a nightmare journey coming in, but he's managed to plan for it, and even though he supports the strikers, he has still managed to get into work today. 20 strike days have been lost since the start of this industrial action, and that has had a big knock-on effect for the economy, for taxpayers, and don't forget the workers themselves.
No, absolutely. Paul, thank you. Let's talk to our Yorkshire and Humber reporter, Anna Riley, who's at Leeds Station now. And Anna, I'm wondering, not only what's happening there in terms of the trains, but also in terms of the passengers and what their attitude is now to the strikers, whether they're losing patience or whether actually there's still a fair amount of support there.
Good afternoon, Stephen. Yes, I'm here at Leeds train station. There's no longer a picket line, but there was earlier this afternoon and this morning. And workers were very much saying that they will continue to strike for as long as this dispute goes on, until that their needs are met, and that's obviously around a pay increase. They're saying at the moment what they've been offered is a real-time pay decrease with the cost of living, but it's also the terms and conditions that they're concerned about. They're concerned about these driver-only operated trains, and they're concerned about the removal of ticket offices as well as potential redundancy. So it's as much about the terms and conditions for them as the pay. I also spoke to the RMT lead for Yorkshire and Humber, Gaz Jackson, earlier today. He said the RMT are willing to get around that discussion table with the government, and they really do want to press for those terms and conditions. And you asked about the passengers as well. Well, speaking to people today, it's mixed opinions really. There is still people that are fully in support of the strikers. Whilst I was on the picket line earlier, there was members of the public coming over and giving chocolate to the workers and saying, you know, well done, keep it up, we're behind you. But speaking to people that are trying to get to work today, it's obviously been the Christmas break, New Year's break, now they're trying to come back to work for the first week, and they're struggling because of these reduced amount of services. There's not many local ones that are going on here, so if people are trying to get to work, they're having to get the bus. That causes more congestion on the roads, and taxis as well. And it's also had a knock-on impact for people that are travelling here as well in terms of tourism. I actually spoke to an American couple earlier. They weren't aware that the strikes were on. They're trying to get to London today, and they were waiting around the station. And you know, with the price of taxis, obviously that would be too much for them to get to London, so they were just having to wait it out.
I mean, the problem with all of this, Anna, is, I mean, say it's the inconvenience is a very fair point, but it's the fact that there doesn't seem to be any hope on the horizon, does there, at the moment? Network Rail saying this morning, well, a deal's within touching distance. Well, that doesn't seem to have happened. And it's the fact we just don't know when or if this is going to end.
Yeah, that's it, Stephen. It seems to be that both sides are saying that they're willing to talk. The government, the Transport Secretary is saying he will, the RMT are saying that they will, and they've been waiting since December for roundtable discussions. So, yeah, when are these talks going to happen? But what we do know is that the RMT has a mandate for the next 5 months to remain on strike, so that'll continue for the rest of the winter and on into spring, and then they may be able to vote again to carry on with these strikes if their needs aren't met.
OK. Anna, for now, thanks very much indeed. Well, of course, all that is just part of the headache which the Prime Minister and the whole government is having to deal with. On top of that industrial action, there's the high inflation, soaring channel crossings, a volatile NHS, cost of living crisis. The Prime Minister's got his hands full for 2023. So let's go through some of those challenges for you. And, of course, the strike action continues with the threat of, at least the potential of, a general strike this year. Rising number of illegal migrant crossings. 2022's Rwanda plan didn't take hold of the situation. How can Rishi Sunak tackle the problem now? There's talk about that number doubling to around 90,000 people crossing the channel in small boats this year. The war in Ukraine, of course. Well, Britain's pledged to continue backing Ukraine, but at what cost? Millions spent towards the war effort. Growing threat of an attack on Britain, so we're told, as a sort of key ally of Ukraine. Tough road ahead there. And the NHS on top of it all. Waiting lists, that record highs, industrial action as well. Could that institution crumble? Well, you've sort of got to hope not, haven't you? And then for all of us, the cost of living crisis, inflation driving up the costs of all the essentials, high interest rates, of course, affecting payments on our homes as well. And then there's energy prices that ties into all of that. The government support is going to waver, of course. The Prime Minister will need to find an alternative plan, will he, potentially, to ensure that we can all survive huge price increases post-April. Let's talk to our political correspondent, Tom Harwood, who's here. Tom, frankly, what an absolute blooming nightmare.
It's not the in tray that any Prime Minister would want. 2023 is going to be a really tough time. We saw just some of those challenges run through there. And, of course, there are many demands of government, not only for spending, but also on different wings. There's the regulatory reform that people want to see as well. And there isn't much time to do it in, of course. We've seen this session of Parliament extended now right through until later this year. We're probably not going to see another King's Speech until September, when we were expecting one. Well, we haven't had one this year at all, have we? And so we're really running through that old legislative agenda and still trying to get things through Parliament. Meanwhile, there seems to be crisis upon crisis that are building and demands for ever more money to be spent when there's ever little actually available to be spent.
I mean, this is the problem, isn't it? And of course, with the strike action, I mean, never mind the NHS, that's almost a sort of separate issue, but with all the strikers across all the industries, the problem is they all want more money to be spent on higher wages, but that's then got the potential of wage inflation, which would then cause everyone problems.
What the government wants to avoid here is a wage price spiral. They say that double-digit increases across the board might sound good in the short term, but in the long term it embeds inflation in the system. The government say that inflation is predicted to fall sharply this year. That's something that they really hope they can stick to. It's one of the only things that really might well go well for them this year. But if we sort of embed those double-digit pay rises across the board, that could really push up the level of prices as well as a consequence, embedding that high inflation, keeping it in double digits for far longer. Now, it's a really tough message for the government to say, because no one wants to hear that the only way to get out of an inflationary spiral is to take a year of pain, is to take that hit. But that does seem to be the message that the government's putting across.
Meanwhile, the NHS is, as I was saying to Olivia last hour, is almost it's a separate entity in terms of the problems, aside from the striking nurses and ambulance staff and all the rest of it. There needs to be reform, doesn't there? Talking to a GP earlier on, saying, well, everyone tries to reform it, but I guess they tinker around the edges, don't they? Are we heading towards a point where actually there's going to have to be some root and branch reform?
Well, it's interesting. If we look at where the NHS was in terms of its funding back in 2010, £128.2 billion. That's the amount that year that was spent on the NHS. This year, it's £180.2 billion. A real terms, 40% funding increase compared to just over a decade ago. Now, have services got 40% better? Do people feel like waiting times have gone down? No, they've gone the other way. Despite tens upon tens of billions of pounds put into the system, more money per person than ever before in the system. This is all adjusted for inflation, of course, as well. An extraordinary amount of money has gone into the NHS, particularly in the last 4 years. And yet, the outcomes seem to be getting worse and worse. Now, it's fair to say that lots of health systems around the world are facing challenges. GPs are striking in France. The German healthcare system is creaking as well. In America, even, hospitals are full. There are clearly aftershocks of the pandemic here that are affecting all countries that were hit by COVID. But there is also something that seems a bit particular to Britain in the way that we are having these outcomes, perhaps in a more extreme way than other countries are having. And perhaps it's notable that the Prime Minister reportedly himself and his family choose to have private healthcare. And maybe you can start to see an argument whereby the government might want to recommend people that can afford it to take some pressure off the NHS by going private themselves.
Yeah, well, maybe that's going to be the way forward. Talking of healthcare, Tom, you should be in bed with a hot water bottle and a lemon sip, frankly. You're not very well at all.
It's true.
But thank you. Well, coming up, we're going to be talking about the UK's Health Security Agency warning those who are unwell to stay at home. You don't want to risk things like COVID, of course, or scarlet fever, which, of course, is also on the rise at the moment. But let's, before that, take a short break, and then we're back with all the details for you.
I'm Camilla Tominey. Join me on GB News on Sunday mornings for a politics show with personality on TV, radio and online. GB News, the People's Channel, Britain's news channel.
I'm Mark Dolan. Join me at 11 on GB News for Headliners, in which I'll be joined by two of the UK's top comedians discussing tomorrow's papers. If it's an important story, we'll cover it, but we'll have some fun along the way. Headliners, the late-night paper review that won't send you to sleep like the others will. 7 nights a week at 11 p.m. on GB News.
Hello, I'm Michelle Dewberry and you can join me every weekday 6 till 7 on Jubes and Kerr. Me and my panel will get stuck right into the day's events and I can tell you, in fact, I can warn you, expect some robust debates, some strong opinions and perspectives from both sides of the fence. It's about you at home as well. I love to read out all of your comments, or at least as many as I can. So join me, Michelle Dewberry, Monday to Friday, 6 till 7 on Jubes and Kerr.
I'm Mark White. As GB News Home and Security Editor, I cover those key issues that are so important to you. Our authorities, our communities doing all they can to combat violent crime. With the public services under unbearable strain, why are we still failing to control our borders? Defence, the first priority of any government, has been continually hollowed out. Can we trust our politicians to protect the armed forces? Join me, Mark White, on GB News.
We are GB News, the People's Channel.
And right across the United Kingdom.
You can find us on Sky Channel 512.
Virgin Media Channel 604.
Freesat Channel 216.
Freeview Channel 236.
And YouView Channel 236.
You can also take us with you on DAB Plus Radio.
With the GB News app and at the website gbnews.uk.
We're absolutely everywhere. Come join us on GB News, the People's Channel, Britain's news channel.
.24 afternoon to you now. Let's return to the strikers, should we? Rail workers are putting on new strikes today. It's day one of two 48-hour strikes by the RMT. Then ASLEF have got a 24-hour strike on Thursday over pay and conditions. Let's head over to Bristol and our reporter Jeff Moody. Afternoon, Jeff.
Hello to you, Stephen. Yes, I'm at Bristol Temple Meads speaking to Dan Paynes from the Rail Delivery Group. Dan, strike action here today. We're seeing pickets outside. In the Times today, it said that people are going to be deserting the railways forever, for a generation. Is that how you see it?
Well, I think whenever there's some big change and there's some big crisis, people will say lots of things. But in reality, actually, the railway industry gets back up and running. It's very resilient, much sooner than people think. That said, certainly the climate has changed from a railway industry perspective. People are travelling less and less for work, and they are having now to choose to travel by train. So I can certainly see the argument that growth as we come out of the pandemic is something that's going to be halted by these strikes until people can see that we're able to run a service that is consistent, which is why we want to get to a point where we can offer colleagues a pay rise that they're looking for, balance that with a sensible set of reforms to bring the railway industry up to date, and at the same time make sure that we don't take any more than our fair share of the taxpayers' money.
Mick Lynch said today that he's winning the argument and he's winning the public support still. Is that how you see it?
Well, I'm not going to get into a tit for tat for this. Actually, the long and the short of it is the only way that these disputes will be resolved is by getting a sensible agreement from everybody. And that's what we're focused on. We want to get these strikes out of the way and we want to get back round to the table and moving things forward.
There's talk of it going on till May. Do you think it'll go on that far?
Well, who knows? It's down to the RMT and the other unions in terms of how they approach the next stage of this. We've got a 8% offer to RMT colleagues on the table at the moment that the RMT has rejected out of hand. We'd like to see them share that with their members and get a sensible view from their membership and our colleagues in terms of how they want to take this forward, really.
OK, Dan Paynes from the Rail Delivery Group, thank you very much indeed. Back now to you, Stephen, in London.
OK, Jeff, thank you. Now to health matters, because the UK Health Security Agency is warning if adults feel unwell, stay at home or wear a mask if you're going outside. Now, this is partly due to scarlet fever and COVID still circulating around at pretty high levels. And it comes after senior NHS bosses have warned that the NHS is under unbearable strain. Meanwhile, nurses are going to be striking again on the 18th and 19th of January. Ambulance staff are going on strike on the 11th and 23rd. So that adds even more pressure to the NHS. Well, let's talk to Roy Lilly, a former NHS Trust chairman. Roy, it's great to see you, as always. this seems like a perfect storm in a way, as far as the NHS is concerned. Look, from taking your experience, but then taking a step back as you've done, how does anyone even begin to relieve some of this pressure?
It's horrendous. I mean, all you can do is to stop doing things, and we're starting to see that. We're seeing now that a lot of the elective procedures, that's the people who get on the waiting list for hips and knees and that kind of stuff, we're seeing operations cancelled because the hospital beds, medical beds, are full. I mean, we've got more people in hospital now with COVID than we had this time last year. The flu is just ripping through the elderly population, and the strep A is causing real problems in paediatric services. So all you can do is to stop doing things and putting everybody you've got in the front line. After that, when you run out of beds, people wait, and when they wait, there's delays in their treatment. Delays in their treatments have we seen? There's in the news this morning. There's a big discussion about excess deaths. There are excess deaths all the time in health systems, and it's a way of calculating how efficient the system is and where the pressures are and what it needs. And so we've got excess deaths now that are running into hundreds a week, and they're all attributable to delays. People are waiting for an ambulance, they die. People are in an ambulance and they die. People are in A&E, they die. People get on a ward and they die. If you get an elderly person who's got a broken neck or femur, normally that's, it's very distressing for the person and the family, but it can be dealt with fairly straightforwardly in the NHS. But if they've been lying on the floor for 8 hours, by the time they get into hospital, they're in a dreadful state and they may not survive. So that's the situation in. All you can do is try and make space, and that includes cupboards, corridors, whatever you've got.
Yeah, which is pretty grim. So that's what you've got for the immediate situation. We need to look long term, though, don't we, for a system that is not working. What's happened to the 40% increase in real terms funding that we've seen, apparently, over the last decade for the NHS? Is it being mismanaged?
It's interesting. I watched your conversation with your correspondent. It was really interesting, and I hope he feels better soon. He shouldn't be at work spreading his germs, tell him. But the interesting thing is, of course, he's done his maths but not his history. What the start of all this, Stephen, is to go back to the end of the world banking crisis. We had 10 years effectively of flatline funding in the NHS. It was under 2% a year. Some cases it was even under 1% a year. Normally the NHS needs about 4% to kind of stand still, to run up the down escalator. But it had nearly 10 years of almost flatline funding. That was when we didn't train enough people. We didn't buy enough kit. We didn't build enough hospitals. We didn't have enough beds. So we went into COVID in a pretty poor state. There were about 40,000 nurses short. And at the time, the waiting lists were at 4.5 million. And I remember going on broadcast programs saying, 4.5 million is a record. We've never seen anything like it. It can't get any worse than this, surely. Well, it has. We've come out the other side of COVID. We've lost a huge amount of staff. There are 120,000 vacancies now. And we've got 7.5 million people, probably more now, waiting for treatment. And it is true the government have thrown money at the problem, but it's the difference between funding and investing. If you get a real problem, all you can try and do is to throw money at it and hope we can hire agency nurses or bring people in from overseas or whatever. But you have to invest over the longer run to get the structural things right. And if you compare the NHS now with other countries, OECD countries, we're in the bottom quartile for just about everything. Beds per head of population, staff per head of population, doctors, nurses, all of that, we're in the bottom quartile. We just don't have enough capacity. That's why everything is chock-a-block.
OK. Roy, good to talk to you. Thank you very much indeed. Oh, well, that's depressing, isn't it? It just goes to show there actually aren't any easy answers to all of this, and it all depends quite what perspective you view it all from. Coming up on the programme, we're going to be talking about the trailers that have been released for Prince Harry's latest interviews. But first, here's your news update from Tamsin.
Stephen, thank you. It's 1:32. Here are the headlines from the GB newsroom. Train passengers are being warned of significant disruption this week as over 40,000 rail workers stage fresh strikes. Members of the RMT union at Network Rail and 14 train operators are walking out for 48 hours from today and then again on Friday, whilst drivers in the ASLEF union will strike on Thursday. It's part of the long-running dispute over jobs, pay and conditions. The government insists it's doing everything possible to increase hospital capacity as top medics describe the current situation as unbearable. More than a dozen NHS trusts and ambulance services declared critical incidents over the festive period. The Royal College of Emergency Medicine says somewhere between 300 to 500 people are dying each week as a result of delays in urgent care. The government says it's giving the NHS and social care sector an additional £14 billion over the next 2 years. A Conservative MP has told GB News she wears a stab-proof jacket for protection when meeting local constituents. Virginia Crosby has warned of the scale of abuse politicians face. She says she's faced threats before and that things have not improved for MPs since the death of Sir David Amess, who was fatally stabbed during constituency surgery in October 2021. Labour MP Joe Cox was also murdered in 2016. Hundreds of thousands of fans have gathered to pay their respects to Brazilian footballing legend Pele, who's due to be buried shortly. Well, this is the procession live. We can see where his coffin has now left the stadium of his former club Santos and is travelling through the city. This an aerial shot now, bringing to you live. Well, earlier, newly sworn-in Brazilian President Lula joined 150,000 people who filed past the coffin at the Santos Football Club grounds. The three-time World Cup winner lost his battle with cancer last Thursday. He was 82. TV, online and DAB+ radio. This is GB News.
We are GB News, and we'd like to say thank you to each and every one of you for bringing us your conversations, for helping our great nation find its voice. We are here for you on radio, television, and online, across England, Scotland, Wales, and Northern Ireland.
It's not the BBC, you actually get your facts right.
We are proud to be GB News, the People's Channel, Britain's news channel.
Monday to Thursday, 9 p.m. till 11 p.m. Join me, Dan Wootton. I'll bring you the sharpest takes and hottest debates.
Do you not believe in prisons?
I don't believe in prisons.
I'm completely stunned.
I guarantee you there'll be no spin, no bias, no censorship.
I actually was personally quite offended by it.
And no reason to go to bed.
So I guess they've always been quite woke.
That's Dan Wootton tonight on TV, radio and online. Monday to Thursday from 9 p.m. till 11 p.m. on GB News. The People's Channel, Britain's news channel.
Hello there, it's Eamon Holmes here from Breakfast on GB News. We're not just on your television and your screens, you know.
We're on DAB plus digital radio, so you can listen to your favourite shows on the move.
If you've not yet listened to GB News Radio, it's very simple. We're on your radio player and TuneIn apps, on your smart speaker, phone or tablet, or online at gbnews.uk.
Take us with you wherever you go. GB News Radio.
You never have to miss a moment of the People's Channel.
Join me every Sunday at 6 p.m. for Gloria Meets. In exclusive interviews, I'll be finding out who our politicians really are and what they really think.
It's something that you would never want anyone to suffer.
I didn't know what channels there were. I didn't think I'd be believed.
I must have weighed about 7 stone and I'm 5'8".
My instincts was to sort of cover this up. I mean, clearly that was a mistake.
Join me every Sunday at 6 p.m. on GB News, the People's Channel, Britain's news channel.
(1:37). Very good afternoon to you. Loads of you getting in touch, which is very nice. Thank you very much indeed. Sandra is not happy with the strikes. Afternoon, Sandra, and says, strikes? What strikes? Blackmail is the name of the game. More money from the taxpayers. Well, that is certainly going to cost us. There's no two ways about it. Anthony says, hi, Stephen. The situation in the NHS is the infrastructure is now too small for the size of population we have on this island. It's my understanding the NHS has only got 137,000 beds. Divide it by 70 million, and it equates to 300 people per bed. Well, I've got to say, I don't know, Anthony, if your maths is right on that. I don't know, you've seen figures I haven't. But if you are right, then that's a concern. So they've got to work out how many of us are likely to be ill at any given time. And at the moment, it's quite a lot, which is a problem. So you may have a very valid point there. Marlene, hi Marlene, says, get rid of high-salaried executives and bring back matrons. And I think a lot of people would probably agree with you on that. A good strict matron on a ward may be what we need. Bit old-fashioned in a way, but, well, things seemed to work back then, didn't they? Some views on Prince Harry. Oh, dare I look at these? I don't know. Marion, hi Marion, says, Prince Harry can never, ever be trusted again. As a British subject, I'm ashamed we have a selfish prince of the royal family, so full of hate for his nation. I don't know. Yeah, I don't know. I know what you're saying. I don't know. I think we've got to be careful not to read too much into it, in a way. We're viewing him as a royal, right? And he's behaving and talking as an individual. And I think those two don't often meet. I mean, I agree he should keep his mouth shut. But no, I don't know, it's very difficult. Stephen says, isn't it sad that Harry believes he and Meghan are the only ones entitled to privacy, whilst he shares what he chooses about his family with the world, knowing that they'll not be able to give their side of events? And again, I think that's a very valid point. They wanted privacy, but they're talking about everything, and they know full well that Charles and William and the Queen and Catherine will not be able to respond. They just can't. So I think that's a very valid point. If you've got a view, whatever it is, gbviews@gbnews.uk. Now, this is an interesting one, because the problems with the Northern Ireland Protocol continue, as we know. Power sharing still in a state of flux, the DUP refusing to return to the devolved government until major changes are made to trading agreements. Now, this is where it gets interesting, because the Irish Prime Minister, Leo Varadkar, who's just come back into office, was one of those who was very, very much seen as the architect of the protocol. He said this morning that mistakes were made on both sides during setting up of the protocol, but now he's willing to make compromises. That all comes ahead of his visit to Northern Ireland coming up, where he says he hopes to find a solution to the protocol. Well, let's talk to our political reporter, Catherine Forster. It's not a U-turn, is it, by Leo Varadkar, but it's certainly an interesting pivot.
More positive language, more emollient language from him, because, as you say, he was Irish Prime Minister when the protocol was drawn up. He had that meeting with Boris Johnson in Merseyside. They had a breakthrough. Boris Johnson's original plan was to have two borders, one effectively down the Irish Sea, which we've got, a regulatory border, and one on the island of Ireland, which, of course, the EU was not going to have any truck with that. So the protocol has not even been fully implemented. We're still in the grace period, and the UK unilaterally continued that, but it has caused massive problems in that effectively Northern Ireland is treated differently. Northern Ireland is still in the EU single market, and that has made goods between the rest of the UK and Northern Ireland, that transit, very difficult. So it does sound like a real softening, a realisation both from Dublin and indeed from Ursula von der Leyen and Maros Sefcovic from the European Commission, that the protocol is causing problems and that they are keen to find a solution. And they're particularly keen to find a solution by April, because April will be the 25th anniversary of the Good Friday Agreement. So it will look like a major political failure if come April we're still stuck here and President Biden apparently is due to come and all of that. But we shall see if anything changes.
Well, it's very difficult to see what can change unless the EU side of things acquiesce, isn't it? Because Westminster seems to be standing pretty firm on their position in all of this. I mean, indeed, Leo Varadkar does seem to say, well, some of the conditions do seem to be just too strict at the moment.
He's admitted that mistakes have been made. He said on all sides that perhaps they've been a bit too strict and that they're going to be flexible and reasonable. But, OK, the grace period is still... we're still with that. So not only would they not have to implement the protocol fully, they're also going to have to soften some of the checks that are existing. So some talk of, you know, green lanes for goods that are going directly to Northern Ireland that aren't going to... I suspect some sort of major fudge will be required.
It sounds like
really.
a fudge, isn't it? So presumably anything that goes into Northern Ireland but not then into the UK, mainland UK,
that goes into Northern Ireland, that goes from the UK to Northern Ireland and doesn't then go into the south of Ireland, will be exempt from checks. Yeah, but we shall see. I mean, how it would work in practice, we don't know. But there does seem like a willingness, a desire to find a solution. I mean, of course, doesn't mean it's going to happen.
No, but I mean, it's interesting because for those of us over here on the mainland, you know, we know about the protocol, we talk about it. It sounds like a political mess. The reality for people in Northern Ireland and businesses in Northern Ireland is it means everything is costing a whole load more money at a time when everything's, you know, it's adding on to the inflationary pressures at the moment, isn't it?
It has made things very difficult, and there's lots of things that you simply can't get in Northern Ireland that you could get in your local supermarket here that you would expect, given that Northern Ireland's part of the United Kingdom, to be able to get there, that you cannot get. And things like even sending flowers, arranging to get flowers sent from England to Northern Ireland, for instance, is not as straightforward as you might think. So it has caused huge problems. I mean, there was one time that it was incredibly difficult even to take your pet from England to Northern Ireland. I think that has been sorted, but it has thrown up major, major problems. And of course, it's made many unionists feel that effectively Northern Ireland has been partitioned and a border, OK, it's not a physical border, but there is a border with checks down the Irish Sea, and that's very, very difficult and potentially a threat to the Good Friday Agreement and peace in Northern Ireland.
OK, Catherine, for now, thank you. Now, let's get back to Harry, should we? New trailers have been released for Prince Harry's interviews that talk about his upcoming book that you'll be able to buy next week if you've not pre-ordered it. If you really want to buy it, I shan't be buying a copy, I'll tell you that. In the interview, in the clips that have been released at least, we hear how Harry wants to reconcile with the King and the Prince of Wales. Well, let's talk to Richard Fitzwilliams, the royal commentator. Richard, it's a joy to see you, as always. Is it just me, or is it remarkable that he's laid into his family very publicly for the last 18 months, really, and now on the launch of the tell-all book says, "I want us all to be close again"?
Well, I mean, this is just wishful thinking on his part. This, of course, is in one of the trailers, and in the context of when we actually see it in the interview, it may be slightly different, because the one way he won't get close again to his father or his brother, let alone if this ever happens, which I must say I doubt, is to give endless interviews, as you mentioned earlier. It's become something of a circus, followed by a 416-page book. And the word of mouth in the press is that the book lays into William, which is not going to be helpful. There is absolutely no question that the Sussexes are guilty of hypocrisy, at the very least, because the only reason they get the contracts they get with Netflix, with Spotify, and with Random House is a poor book contract, reportedly, is because they're royals, and yet they resent the royal family. So they want an apology. They want the royals to realise how badly they treated the Sussexes. He talks about, again, about being briefed against. It's all so negative.
Do we believe it? I mean, because what I mean, Richard, is there is got to be a sense. This is the firm. It is the company. There is more just going on here than just a family feud, isn't there?
Oh, of course there is. But firstly, do we believe it? Well, he hasn't produced any evidence. And in the Netflix docuseries, they constantly referred to the press. The press were referred to, in fact, as an extended arm of the royal family public relations. And they produced no evidence that I could see that they were being briefed against. The idea also is apparently that the others were jealous, the other royals were jealous of Meghan and her successor. They resented the fact that she got a front page, which younger royals would tend to do, especially if they were newer, and so on. I mean, it is a question of, firstly, the truth, then there is their truth. What I'm hoping is that Anderson Cooper and possibly Tom Brackley, although he is very close to the Sussexes, reportedly, might probe, because Oprah didn't probe at all on the various questions she asked, and the Netflix series was completely hagiographic. So they get away with it. That is what is extraordinary. But that is the fact. The facts are that there's so much interest in the royals that every single trailer, everything that's said is picked up. And the other trouble is, what could the royals possibly do to indicate that certain things are simply not as the Sussexes say? They can't go point by point as a rebuttal. If they do, as the Queen did after Oprah, a very dignified statement that some recollections may vary, but it doesn't alter the fact that a lot of people believe what they hear, and it's affected the royal family's popularity among young people. They're being asked to the coronation. Apparently they will be invited, so it's said. But we'll have to wait and see what's in that book to see whether there's any possibility, even in the remotest future, of some sort of reconciliation, especially between the brothers. I strongly doubt it.
No, I mean, I've got to ask Richard just briefly, because a lot of these allegations and claims are being made at a time when the Queen was still alive, of course. I very much doubt anything or much went on that the Queen wasn't aware of. Is he, in effect, attacking his grandmother?
Well, he implied that in the Netflix docuseries that his grandmother was, at the Sandringham Summit, some sort of, you could almost say, a puppet-like figure in the hands of forces that were against them. I think there's no question that Harry and Meghan, when the Queen was alive, went through the motions of respecting her. They very possibly do, but there's little doubt that her last years were not made easier by their antics.
Richard, as always, it's good to see you. Thanks very much.
Thank you.
Now, President Zelensky says Russia is planning to use prolonged drone attacks to try to exhaust Ukraine. The intelligence report that he got suggests Moscow is planning to use Iranian-made Shahed drones. Now, Ukraine carried out an attack on the Donbass region that saw 63 Russian troops die. Now, that's according to the Kremlin. Ukraine was claiming that it was 400 Russian troops who died. They made that claim a couple of days ago. Let's talk to Rear Admiral Chris Parry, former NATO commander. Chris, good to see you, as always. What do we make of this intelligence that Ukraine said it's got its hands on?
I don't think it's anything new, to tell you the truth. I think we're aware right from the start of this conflict that drones have been right in the forefront of the bombardment of both Ukraine and also selected facilities in Russia as well. It's a feature of modern warfare. They're easy to produce. They produce a very high explosive impact when they arrive. And if you can get your hands on them, you're going to use them, I think.
Exhausting Ukraine, though, as a tactic, well, you can understand it to an extent. Is that a possibility? Are Ukraine stretched to that point, do we think?
I think Ukraine's doing incredibly well under quite a severe bombardment. Let's not forget, it's not just the drones that Russia is using. It's using very large numbers of ballistic and cruise missiles as well. And I doubt if many countries could withstand the sort of bombardment that's going on. I think what the international community needs to recognise and condemn, though, is the indiscriminate nature of the targeting. Some of it is against military targets, but the vast majority is designed to take out infrastructure that supports human life and also residential and civilian areas. It's a clear war crime. It's systematic, and Russia is currently getting away with it.
Is there a very real concern now that is, I mean, certainly you get the impression that Putin is running out of some sort of steam and some dissent is growing amongst the Russian population, those who are more aware of what is going on, perhaps. Quite what percentage that is, we don't know. But is there a sense that there could be an escalation to really try and bring this to an end from either side, actually?
Well, I think what we're looking at the moment is the Russians are settling down in the areas that they're occupying in the south, the 4 provinces that they've annexed. They're trying to hold on there at the moment and prepare, I think, for a very big offensive, probably on 2 axes when they're ready, either in the later on in the new year or towards February. One of those, I suspect, will be either against Kiev or against the western region of Ukraine. That's coming from Belarus, and another one that seeks to strike at Mykolaiv and Odessa in the south, because what Putin really wants is the bottom third of Ukraine, including Crimea. He can then say, look, I've done what I intended to do. This is my legacy, and we can now impose terms on Ukraine. In the meantime, Ukraine is trying to probe Russian weaknesses, and I suspect also trying to cut off Russian supply lines to Crimea by penetrating that area down between Crimea and the Donbass region. Either of those eventualities, I think, will lead to a significant change in the campaign. So Ukraine's got its own objectives, so has Russia. In the meantime, we've got nailing Putin. I think general opinion is he's got Parkinson's, and I should think the vultures are currently gathering in the Kremlin. But we shouldn't, I'm afraid, have any wishful thinking about the way the Russian population is. It's solidly behind Putin. There's a bit of dissent, but nothing that is going to trouble, I'm afraid, the people in Moscow.
No, unfortunately not. Chris Parry, good to talk to you. Thanks very much. Depressing stuff, isn't it? Let's get some of your thoughts today. Pretty strong opinions on the National Health Service. PK, hi PK, says no MP has the guts to reform the NHS as they're just looking after their own job and are scared of the woke and lefties who will scream and shout that they're trying to privatise the NHS. I think anyone from any party, actually, it's a huge problem because the NHS is something which a lot of people just don't view can be touched. I think a lot of people are coming to the understanding, though, that more does need to be done. Anthony says, hi, Stephen. The Conservative government are downsizing many hospitals. My hospital had 654 beds. The new hospital in Sandwell only has 350. Blame the accountants. Cottage hospitals being sold off and the cash going straight into government accounts and not reinvesting in local trusts. And it's that investment and reinvestment that Roy Lilly was talking about. You can't just throw money at the immediate problem. You've got to have invested money to plan for the future. Maybe that's where things have gone wrong over the past decade or two. Luke says one answer is old school matrons. Oh, we heard this before. You only have to watch the Carry On films to see how the matrons ruled the hospitals. As an ex-infantry soldier, I know how effective the regimental sergeant major figure is in running institutions with high staffing levels. They've started at the bottom, worked their way up. They know the job and they know how it works. Very, very good point. Don't go anywhere. We've got much more coming up in the next hour. But first, though, here's your weather forecast.
Hello, I'm Aidan McGivern from the Met Office. Most of us will see outbreaks of rain today. It will also be windy and it will be mild. The wind's coming from the southwest at the moment, bringing a lot of mild air with them, but also bringing an awful lot of cloud, outbreaks of rain, a couple of weather fronts to watch out for. One has already pushed through, bringing a spell of rain earlier, but the next weather front is moving in for the afternoon, and that will pep up the rain once again. So some gaps in between the spells of rain, especially in the east and for northern Scotland, where it stays fairly cold, but it is turning milder here. So there are snow that we've seen eventually more confined to the higher tops of the mountains, and the rain replacing it. A lot of rain across the country, a strong wind, but that wind coming from the southwest, so it is going to be feeling mild, especially in the south. The rain, heavy at times as it moves through, could cause some issues for central and southern Scotland, particularly over higher parts, and it stays damp in the south as well through the evening and overnight. It's a windy night, but the winds, of course, since they're coming from the southwest, mean that it's going to be mild
Temperatures in many places in the double figures by dawn, just in the mid-single figures there for northern Scotland, where the rain eventually moves in overnight and then clears slowly through the morning. The rain also clearing the southern half of the UK, but in between there is a band of wetter weather for southern Scotland, for northern England and for Northern Ireland, that turning a bit more showery later in the day. And it's a mild day. Blustery, yes, but temperatures up at 14 Celsius in the south, 7 or 8 for Scotland and Northern Ireland. Some damp weather returning to Cornwall and Devon for a time during the afternoon and early evening, but that clears through. And then clear spells for many overnight on Wednesday night, showers in the north tending to fade away. Thursday looks like another showery day for many. Friday a little drier, but further rain or showers coming along for the weekend.
Monday to Thursday nights on GB News. At 6, it's Dubes & Co. 7 o'clock, Farage. At 8, join Mark Stein. And at 9, Dan Wootton Tonight, followed by Headliners. On TV, radio and online. This is GB News.
We are GB News, the People's Channel.
Why not take us home with you by visiting the GB News shop at gbnews.store. You'll find all the official merchandise, a really good present actually for yourself, your friends or your family.
We ship across the UK mainland at no extra cost. GB News, the People's Channel.
Here on GB News Live, we'll be keeping you in the picture, finding out what's happening across the country and finding out why it matters to you. We'll have the facts fast with our team of reporters and specialist correspondents. Wherever it's happening, we'll be there from 12 noon on TV, radio and online. GB News, the People's Channel, Britain's news channel.
Monday to Thursday on GB News, it's Bev Turner Today from 10 a.m. We're going to be here for you, our GB News family, to keep you up to date, but also make you smile.
The guy went from puberty to adultery.
And I can't wait to bring a few of my own opinions.
I have no time for cultural totalitarianism.
We'll engage in passionate, but always polite debate, with your thoughts and opinions at the centre of it all. Only on GB News, the People's Channel, Britain's news channel.
Hi there, it's Stephen and Anne.
At breakfast from 6 a.m, you'll always be caught up with everything you need to know, the latest headlines, opinions and debates.
We'll bring you the good news and the bad, but most of all, we're here for you.
Remember, send in your views and let us know what you would like us to talk about.
That's because we're your news channel. And every morning at 6 a.m, it's breakfast on GB News. Two o'clock, very good afternoon to you. This is GB News Live. This is what I've got coming up for you in the next hour. Strikes continue into the new year. More industrial action from rail workers kicked off today. Mick Lynch, the union boss, is none the happier in 2023, criticising the government of avoiding proper negotiations. Pressure on the NHS is mounting. They face unhappy staff, long waiting lists and, of course, all this flu and COVID that's doing the rounds at the moment. Will our healthcare system actually make it through the next year? Well, it will. But in what sort of state, I don't know. In Ireland, Prime Minister Leo Varadkar has said mistakes were made on all sides in the handling of Brexit, vowing to be flexible and reasonable when attempting to solve issues with the Northern Ireland Protocol. We'll bring you the latest on that. Could be an important step forward. Remember, we want your views, as always. You know that, gbviews at gbnews.uk. Get in touch, we'll run through those as I get them here in the studio. Before all that, though, let's have a look at the latest news headlines with Tamsin.
Stephen, thanks very much, and good afternoon from the GB Newsroom. It's 1 minute past 2. Over 40,000 rail workers are staging fresh strikes this week, causing disruption for people returning to work after the Christmas break. Members of the RMT union at Network Rail and 14 train operators are walking out for 48 hours from today and then again on Friday, whilst drivers at the ASLEF union will strike on Thursday. It's part of the long-running dispute over pay, jobs and conditions, which RMT General Secretary Mick Lynch told us is vital for the future of the industry.
Up to the government now to show us that they mean business and that they want to facilitate some talks, rather than undermining them as we believe they did before Christmas by putting provisions in that they know none of the railway unions can accept. So if we can get some realistic talks with some proper proposals and progressive talks, we'll work with all the parties to get that on.
Transport Secretary Mark Harper, however, says it's time for the unions to get off the picket line and round the negotiating table.
Government's going to continue to work really hard to try and help bring the two sides together to get this resolved. I know how frustrating this is for commuters, and the danger is it puts people off using the railways, which is a bit of self-harm on the part of the rail unions that haven't settled this dispute. What I think the government can do is make sure there's a fair and reasonable offer on the table, which there is, facilitate those negotiations between employers and trade unions, and try and make sure we get this dispute resolved for the travelling public.
The government insists it's doing everything possible to increase hospital capacity, as top medics describe the current situation as unbearable. More than a dozen NHS trusts and ambulance services declared critical incidents over the festive period. The Royal College of Emergency Medicine says somewhere between 300 to 500 people are dying each week as a result of delays in urgent care. The government says it's given the NHS and the social care sector an additional £14 billion over the next 2 years. People travelling to England from China will not be forced to quarantine if they test positive for COVID on arrival. The government says the move is about collecting information due to the Beijing government refusing to share its own coronavirus data following a surge in case numbers there. However, testing will be optional for passengers landing at London Heathrow. Under the new measures, people flying to England from China will be required to show a negative COVID test before boarding the plane. A Conservative MP has told GB News she wears a stab-proof jacket for protection when meeting local constituents. Virginia Crosby warned of the scale of abuse politicians face. She says she's faced threats, adding things have not improved for MPs since her peer Sir David Amess was fatally stabbed during a constituency surgery in October 2021. Labour MP Jo Cox was also murdered in 2016.
I have been in difficult situations. I have surgeries. I do face-to-face surgeries where I wear a stab jacket, obviously following the murder of David Amess, and also I have security protection as well. And I think it's important that I have direct contact with my constituents. And unfortunately, this is one of the things that I have to do to ensure that I can actually do the job that I was elected to do.
A married British couple are among 4 people killed in a mid-air crash between 2 helicopters in Australia. Diane and Ron Hughes, aged 57 and 65 from Merseyside, were on holiday when the accident happened in the Gold Coast region. 3 others were left critically injured. Queensland police say the initial investigations indicate the collision occurred when one helicopter was taking off and the other was landing. Russia says 63 of its soldiers have been killed in a Ukrainian attack in the occupied region of Donetsk on New Year's Eve. Ukraine initially claimed it killed 400 Russian fighters, a claim Russia has called an exaggeration. The attack hit temporary barracks in the eastern Ukrainian city of Makivka, where Russian forces have been stationed. Hundreds of thousands of fans have gathered to pay their respects to Brazilian footballing legend Pele, who's due to be buried shortly. A procession has led his coffin from the stadium of his former club through the city of Santos on top of a fire engine. Earlier, newly sworn-in Brazilian President Lula joined 150,000 people who filed past a coffin at the Santos Football Club grounds. The 3-time World Cup winner lost his battle with cancer last Thursday at the age of 82. That's all from me for now. Back to Stephen.
Tamsin, thank you. Now, 40,000 RMT members have walked out today over pay and working conditions. It's the first 48-hour strike of the new year, more planned later this week. Well, another 48-hour strike on Friday. ASLEF are actually striking, that's the train drivers' union, striking on Thursday. So it pretty much scuppers the rails all week, to be perfectly honest. We've got reporters up and down the country getting the latest on the strikes for us. So let's start with our national reporter, Paul Hawkins, who's at Euston Station for us, where, I mean, clearly not a lot going on, Paul, but not much happening with the negotiations either, it would seem.
Yeah, that's about the crux of it, to be honest, Stephen. It's a pretty decent analogy, to be honest. Yeah, there was a picket line here earlier today. There were some union members there, about 7, maybe 10 tops, and Mick Lynch, the boss of the RMT, was also here. Him being instructed by Mark Harper, the Transport Secretary, to get off the picket line and around the negotiating table. Now the picket line's moved away, perhaps they'll both be doing that. Certainly the mood music from both sides appears to be they do want to get around the negotiating table. Yes, there's been some antsy between them, some criticism from both sides aimed at the other, saying that you're holding up the negotiations. For example, the RMT saying that the government at the last minute during that round of talks just before Christmas threw in that condition that there were to be driver-only trains, and the RMT saying, no, that is a red line for us. Nothing is going to be resolved if you're throwing in that condition. The government, on the other hand, saying that the RMT, unions in general, are a block to progress. So both sides criticising each other, but they are at least willing to get around the negotiating table. Nevertheless, the fundamentals of the dispute still haven't shifted, and so there's still a bit of a way to go if this dispute is to be resolved. But Mick Lynch, the boss of the RMT, did speak to us this morning, and he told us that he does want to see an end to this industrial action.
Well, we want a resolution. We're ready and able to discuss with the companies and the government whenever they want to put that on. We're hearing that the Transport Secretary is saying that he's keen to convene talks. And if there's an invite, we'll be there today, tomorrow, or whenever it is that they want to get there. But there has to be a change. We've been hearing the same stuff for 6 months or more, that they want to facilitate a settlement. Well, they've got to prove that now. They've got to change the equation that's being put to us in those talks. And we will look forward to that if that comes true.
So this is a 48-hour strike today. There's another 48-hour strike on Friday. And then on Thursday, ASLEF, they're the union that represents train drivers, will also go on strike. So significant disruption to the UK rail network this week. And if we look at the wider economy, Katie Nichols, the boss of UK Hospitality, saying that between June last year and this week, the hospitality industry has lost £2.5 billion. That's the hospitality industry alone, without taking into account the wider UK economy. So the country is losing a lot of money with these strikes, but the unions say that they are adamant they are going to continue to keep striking for the rest of the mandate period that they have for strike action if they are to improve the conditions in which their workers operate, and also to get those pay rises.
OK, Paul, thank you. Well, let's see what the impact is having at Leeds train station. Anna, what's happening there?
Yes, much the same as what Paul has mentioned, really. There was an RMT picket line here earlier today, and people were standing firm. They were saying, we won't accept anything less than an improvement in terms and conditions, and that pay rise that will cover the cost of living crisis and an increase in energy bills. They feel that what they've been offered at the moment is a real-time pay decrease. So a lot of solidarity amongst the workers here this morning, saying that it's not just about pay, it is about those terms and conditions as well. And the driver-only trains is something that they're really pushing against. In terms of the impact on passengers here, there has been a reduced service. The last train that will be running is just after 5 o'clock here, and the last one coming in just after 6. And we know across the network, across the UK, it's only around 20% of services that have been running, the same going into tomorrow as well. In terms of support as well from people, speaking to people here, it's been a mixture of opinions. There's been people actually coming over to the picket line, giving chocolates out to the striking workers, but there's been other people telling me they are feeling feeling inconvenienced now. They want to get to work. It's the first week back from the Christmas and New Year break, and people just want an end to it, really.
Well, understandably so. Let's head to Birmingham New Street. Jack, I mean, is there any support there for the strikers?
Oh, definitely, Stephen. I think the majority of people that I've spoken to today have actually been fully supportive of the RMT and this strike and this industrial action. Of course, they understand and they're a bit annoyed about the disruption that it has caused them. They've had to make alternative arrangements. Many people in the city using the tram this morning, using the buses, of course, with that government subsidised scheme to get a single ticket now in England for £2. But in terms of the actual industrial action, lots of people saying to me today that the only way to end that would be for the government and the train operating companies to give the RMT the money that they want. That's how many people here in Birmingham feel how that's the proper way to end this strike. Of course, we know in terms of what has been put on the table by other operating companies. Network Rail, of course, put forward a 9% pay rise. It was a 5% backdated pay rise for 2022, a 4% pay rise for 2023. That was rejected by 55% of the RMT eligible RMT members when it went to them. In fact, somebody from Network Rail that's actually striking today and walked through the station had a chat to me a little bit earlier on. He was telling me how it's not just the pay rise. He said everyone's struggling with the cost of living. It's the conditions of how I work. You know, sometimes he's having to deal with very fast trains going right next to him. He doesn't feel like he's necessarily safe completely at work. He feels like some of the shift hours, other things he was telling me are the reasons why he's not currently happy. And he said he's been on the same amount of money for the 18 years almost that he's been at Network Rail, and so it's not just about a pay rise, it's about backdating that as well. We don't really know when this is going to end. They've got to come to the table, both the RMT, the government, rail operating companies, come to the table to try and negotiate this. The RMT and Mick Lynch haven't really given a specific figure to what they'd accept. They don't know a specific figure. We understand it will probably be around inflation, but it's those conditions, those driver-only trains that Mick Lynch saying is a red line, things like removing ticket offices from stations across the country, that means right now this disruption is going to continue for the coming weeks.
OK. Jack, Anna, Paul, thanks all. Well, I'm afraid we're not clear of the strikes. Away from the trains, there are now 2 more days this month when nurses are planning to strike. 18th and 19th of January, plus ambulance workers are planning to strike on the 11th and 23rd as well. Well, let's talk to a GP at Same Day Doctor, Dr. Lawrence Gellis, about all of this. Lawrence, good to see you. Do you have any sympathy with what the nurses are doing?
I have a lot of sympathy. I think nurses, paramedics, junior doctors are underpaid. There's no doubt about that. So I support their claim to be paid more, particularly during the cost of living crisis. Having said that, I have great difficulty embracing the idea of a healthcare worker going on strike and removing their labour. I think it's going to put patients at risk. This idea that somehow that they'll come off the picket lines if there's an emergency, it doesn't wash with me. Every cancelled operation, every delayed investigation, every delayed outpatient appointment affects someone's life. And they have to face up to the fact they are choosing to affect patients' lives in a considerable way. And there's no getting around that. I know they'd like to pretend that it'll only affect routine work, but no, it will affect patients' lives, and that's a choice that they're making, and it's one I'm afraid I don't support.
So, well, look, I mean, it's an interesting point that you raise. The question it really raises at a time when they are really struggling, as you say, in your own view, they're underpaid. How do they actually make their voices heard in an effective way without this strike action?
OK, well, let me put it this way. Patients are very, very sick at the moment. I haven't stopped working for the past 2 weeks. We have patients with influenza A, RSV, COVID, pneumonia, lots of coughs and sinusitis, people who are very, very sick. So to choose to strike now to get maximum attention is also causing maximum disruption to healthcare. They could choose to strike in the middle of summer, but they are choosing to strike at a time when the system is overloaded through no one's fault. You can blame government if you want. I'm not a political person. The reason we're seeing a lot of respiratory infections at the moment is because we've been locked down for 2 winters. We didn't see coughs and colds at all. I commented this time last year, we weren't seeing it. So we are really being overwhelmed with respiratory infections, and we're not able to discharge people from hospital. So to choose to strike now is causing maximum effect on patients. Now, if that's the object of the exercise, I understand that, but I don't agree with it.
Point though where, and I mean, for the medical professionals I've talked to, I mean, there are concerns over pay. Yes, we get that, and they want a very large pay rise, it has to be said. However, a lot of them are just concerned with working conditions, staffing levels, and problems which actually are going to take a long time to overcome. It's almost, it seems like an impossible challenge, actually, for any government, doesn't it?
I'm afraid you're right, Stephen. It is very, very difficult. Even if we paid the doctors, the paramedics, the nurses what they wanted, it's not going to change the health service tomorrow. You know, ambulance drivers, paramedics are not going to drive faster because they're being paid. It's not going to change anything in the short term. It may or may not improve retention of staff in the medium term. But you're right, the problems faced by the health service appear to be insurmountable. And another reform, another shifting of the deck chairs is not really going to make a big change. We need to rethink it. I have to say that without wanting to put all the blame on the patients, there are stories of people who are trying to get hold of their GP because they've got a runny nose. And when they can't get a GP appointment, they're dialing 999. I mean, a GP actually posted on social media yesterday, please don't do this. I do think that the service has been free at the point of use for so long that some people abuse and misuse the system. And to a large extent, the 999 service is misused. So I would actually like to ask the public to look at how they're using the health service and to recognise it may be free at the point of use, but it's not free. It actually costs people a lot of money to run this system, and we should respect it and use it appropriately.
I mean, do you think it's time to look at things like even very small fees for either an appointment or perhaps a sort of missed, £5 fine if you miss an appointment or repeatedly miss appointments? Would that sort of thing make an impact?
I think it's time to look at it, Stephen, but politically it would be almost impossible to introduce for any government of any nature. I think it's time that someone independent of government, and I'd like the medical profession to take control of this, because we, the doctors, are providing an inadequate service. We should be unhappy with it, and we should say, let's improve it. And a small fee would actually deter a lot of time wasting and improve access for the people that need it most. Having said that, people have been talking about charging a fee for a long time. I think it would be very hard to introduce right now and politically very difficult. But to me, it's probably the simplest, most straightforward solution to this problem.
It's really good to talk to you. Thanks very much. Interesting views. I always think it's fascinating when you hear from someone who is, facing patients on the front line, whether through the organisation he's working through at the moment or within the NHS, but actually you're real people dealing with real patients and to get their view. But as he says, it'd be very hard politically to implement what he was suggesting there. But anyway, your thoughts on that would be very welcome. gbviews@gbnews.uk. You may have a view on this as well. In Northern Ireland, power sharing is, of course, a state of flux at the moment. It's very difficult. The DUP is demanding major changes to the Northern Ireland Protocol, which we always hear a lot about and nothing ever seems to change. Well, perhaps it will now, because Irish Prime Minister Leo Varadkar, who's just gone back into the job, is going to be heading to Northern Ireland in the coming weeks, and he wants to find some solutions to the situation, apparently. Let's talk to our political reporter, Catherine Forster, who's here in the studio. Now, it's worth pointing out that Leo Varadkar was Taoiseach when the Northern Ireland Protocol was brought into being. He's seen to be one of the architects of it then as a result. Now he's saying, yeah, it's not quite right. Maybe we can tweak it. Do you think he's being sincere on that?
I think he is. I suspect that time has passed, a few years have passed since the UK voted to leave, and perhaps some of the bitterness and some of the rancour has faded and they realise that we have left and we're not coming back. But certainly he had taken quite a hard line, along with France's Emmanuel Macron, during the Brexit negotiations. Leo Varadkar and Monsieur Macron were seen as being quite obstructive, shall we say. And the previous Irish Prime Minister, because the Irish government's currently got a coalition deal, Michael Martin, was seen as being more helpful and more understanding of the unionist perspective. But Leo Varadkar has come back, and now he's saying, yes, mistakes were definitely made, and we're willing to be flexible and reasonable in Dublin. He's also saying that also applies to the European Commission, Ursula von der Leyen, Maros Sefcovic, and they are keen to find a solution. Now, we shall wait and see, but there is the 25th anniversary of the Good Friday Agreement coming up in April. President Biden is due to come. It will be a big political failure if they can't find some way through this, because it is not working as things stand.
But it's not going to be a solution, is it? Is it just going to be a fudge, but a fudge that we're happy to live with?
I suspect so. I suspect so. I mean, the protocol is not being fully implemented as it is, and it's still causing major problems, partly in that the regulatory checks are making trade between the Great Britain and Northern Ireland difficult and putting these trade barriers in place, and partly because it's really upsetting the unionists in Northern Ireland, who feel that effectively Northern Ireland has been partitioned away from the rest of Britain, and that is absolutely fundamentally unfair. They're being treated differently because they're still in the European Union single market. They're in the UK Customs Union, but they're in a very strange situation.
It seems very difficult to see how, unless there is a full acquiescence, though, on the side of the EU, that unionists are going to still say, yes, we're happy enough to reform the government.
Well, they'd like the protocol to be gone completely, wouldn't they? Yeah. But of course, it's not going to happen because we've left the EU. There's got to be some checks somewhere, I think it will be...
But do you think then the unionists will... I mean, it's all negotiations again, isn't it, as we see with the strikes. Do you think the unions will see that... The unionists, I beg your pardon, will see that actually some movement has to be made on their part?
I think so, because, I mean, ultimately, they're not going to want to be out of government in Northern Ireland indefinitely. This has been rumbling on for a very long time now. There is no devolved government sitting in Stormont. The people that should be looking after all sorts of matters important to the Northern Irish population are not able to do their jobs. So something needs to shift. But it does sound like a willingness on the part of Dublin and the EU, and let's see how far they're prepared to
go. Yeah, Catherine, thank you very much indeed. If you've got a thought on that, do you think it's time for a little bit of compromise on all sides? It would seem, at least, that Leo Varadkar is taking the first step. If you've got any thoughts, if you're in Northern Ireland, gbviews@gbnews.uk. Coming up, as Catherine coughs away, you're not well either. What's wrong with our political team at the moment? You're all ill. Dear me, we're going to be looking ahead to Rishi Sunak's very full in-tray of issues.
Every morning from 6 o'clock, we'll wake you up with GB News Breakfast with all the stories you didn't know from the night before.
So whether it's serious news, entertainment, or your own views from all over our great nation, we're here to kick off your day with a smile.
And the national media should be reflecting and reporting what's happening here. You will notice the northwestern accents.
Whether you're with us on TV, radio, or online, every morning, it's breakfast from 6 a.m. Hope you can join us.
We are GB News, right across the nation. You can get us on television, on radio, on digital. We're absolutely everywhere.
Amazing! You see, amazing!
You remind me of me in the European Parliament. But here's the most important bit. We are not part of the mainstream establishment. We think and speak just like you do. We are the People's Channel.
Magnificent. That's really, really thoughtful.
Come and join us on GB News, the People's News Channel.
My name's Tom Harwood and join me 9:30 a.m. every weekday for The Briefing, your one-stop shop for everything you need to know about what's going on in politics today.
I wonder if this is a deal that might need to be like the biscuits in this factory, twice baked.
Is there not an opportunity here to win out against the extremes?
Tom Harwood, GB News.
What are you going to do about it?
Things should have been done differently, and they certainly are being done differently.
Don't miss it. The Briefing with me, Tom Harwood, 9:30 Monday to Friday on GB News.
Join me, Nana Akue, Saturday and Sunday afternoons on GB News. Expect fiery debate and passionate discussion as me and my panel tackle some of the biggest topics hitting the headlines. It's a place for everyone's opinion. No one gets cancelled, but no one gets an easy ride.
Oh, she's on it today!
Be ready for conversations that are fierce, frank, and of course, fun. Every Saturday and Sunday afternoon from 4 p.m. on GB News, the People's Channel.
2:28 now, with widespread industrial action, stubbornly high inflation, soaring channel crossings, a volatile NHS and a cost of living crisis. Phew, safe to say Rishi Sunak has got his hands full. You've got to laugh, haven't you, really? Otherwise you'd just cry. Let's have a look at some of the key challenges then. Strike action continues across industries. Threat of a general strike potentially this year. We've got a problem with illegal migrant crossings, numbers continuing to rise. That Rwanda plan, of course, didn't take hold. So how can the PM solve that one? The war in Ukraine, well, it's more difficult for the PM to solve, but Britain has pledged to continue backing Ukraine, but at what cost? How long for? Then we've got the NHS, waiting lists and industrial action threatening to crumble the institution. The cost of living crisis, inflation driving up the cost of the essentials, high interest rates affecting our mortgage payments as well. And then we've got, to top it all off, the energy prices, government support wavering on that one. What's going to happen post-April when the sort of bailout we all get every month on our bills is actually going to be reviewed, isn't it? Let's talk to our political reporter, Olivia Utley. What a melange of issues. I don't quite know where to start. I don't know which one is the most important out of all of these for the Prime Minister to really tackle head-on to try and solve the rest.
Well, yes, everything ties into each other so much here. And I think maybe, well, we can start with the war in Ukraine. That's the one that we've got the least control over. But if the Prime Minister carries on giving generously to Ukraine, as Boris Johnson did before him, obviously there's a massive advantage in that it positions Britain as a sort of global leader, which is exactly what we want post-Brexit. But on the other hand, we've got Sunak getting a little bit worried that the cost of living is biting people at home, and support for Ukraine might start to ebb away at home as people worry about their own keeping their own families fed and warm over the rest of this winter.
And yet, of course, if it helps resolve the crisis in Ukraine, then actually we all benefit.
Absolutely, and that's the other consideration to take in. While the war in Ukraine rages on, energy prices are going to remain high all over the world. And while energy prices are high, of course, you've got people, finding it difficult to feed their families and stay warm. But you've also got an inflation problem. Mm-hmm. And when you've got this inflation problem, then you've got people demanding higher pay from their employers, understandably, to try and get them through the crisis. But that leads to strikes. As we've seen, the public sector can't afford massive pay rises for everyone in the middle of a recession. And then once you've got strikes, the whole country seems to grind to a standstill, as we've seen over the last couple of weeks. So we've got all these sort of balancing all these pressures out at the same time. And on top of that, of course, you've got the biggest lever that the government can pull to try and bring down inflation is raising interest rates. But interest rates have been so low for so long historically. You've got these low interest rates baked into the system, which means that if interest rates go up really quickly now, then you've got people who will have borrowed a lot of money for their mortgage at very, very low prices, suddenly being unable to make their mortgage repayments. People in negative equity. asking for pay rises. So you've got all of these competing pressures coming at Rishi Sunak at the same time. And of course, he does have this pretty sizable Conservative majority, but we know that morale on the Conservative backbenches is pretty low at the moment. Then you've got the House of Lords not really, well, pretty sort of Remainer, at least, House of Lords, who isn't particularly in sync with the government. So you've got a pretty weak Prime Minister with a very, very full in tray.
And somehow then, I mean, it seems the only solution is pain. Short-term pain for long-term gain. So he's got to somehow sugar the pill, hasn't he?
Yes, and what he seems to be doing so far is, you know, giving out help packages, very similar to what he did during COVID with the furlough package, but he's been giving out energy support, but as you say, the taxpayer can't afford to keep footing that bill forever. The other solution, which you've got quite a lot of pretty tetchy Conservative backbenchers talking about now, is, of course, growth, big economic growth, and a sort of bottom-up economic growth plan, like massively liberalising planning laws, for example, making it much easier for employers to set up new businesses and employ people, cutting all that red tape, something like Liz Truss proposed.
Yeah.
But, of course, we know how that ended up. So Rishi Sunak is pretty hamstrung at the moment.
It's very difficult. Olivia, thanks very much indeed for that. If you've got any solutions, and you might do, gbviews@gbnews.uk. Much more still to come for you, but first, Tamsin's got your news update.
Stephen, thank you. Good afternoon from the GB newsroom at 2:33. Over 40,000 rail workers are staging fresh strikes this week, causing disruption for people returning to work after the Christmas break. Only 4 out of 5 trains are running as members of the RMT union at Network Rail and 14 train operators are walking out for 48 hours from today. They'll walk out again on Friday, whilst drivers at the ASLEF union will strike on Thursday. It's part of a long-running dispute over pay, jobs and conditions. The government insists it's doing everything possible to increase hospital capacity as top medics describe the current situation as unbearable. More than a dozen NHS trusts and ambulance services declared critical incidents over the festive period. The Royal College of Emergency Medicine says somewhere between 300 to 500 people are dying each week as a result of delays in urgent care. The government says it's giving the NHS and the social care sector an additional £14 billion over the next 2 years. A Conservative MP has told GB News she wears a stab-proof jacket for protection when meeting local constituents. Virginia Crosby has warned of the scale of abuse politicians face. She says she's faced threats before and that things have not improved for MPs since the death of Sir David Amos, who was fatally stabbed during a constituency surgery in October 2021. Labour MP Jo Cox was also murdered in 2016. Hundreds of thousands of fans have gathered to pay their respects to Brazilian footballing legend Pele, who will be buried today. A procession has led his coffin from the stadium of his former club, Santos, through the city on top of a fire engine. Earlier today, newly sworn-in Brazilian President Lula joined 150,000 people who filed past the coffin at the Santos Football Club grounds. The 3-time World Cup winner lost his battle with cancer last Thursday. He was 82. TV, online and DAB+ radio, this is GB News.
I'm Mark Dolan. Join me at 11 on GB News for Headliners, in which I'll be joined by 2 of the UK's top comedians discussing tomorrow's papers. If it's an important story, we'll cover it, but we'll have some fun along the way. Headliners, the late-night paper review that won't send you to sleep like the others will. 7 nights a week at 11 p.m. on GB News.
Hello, I'm Michelle Dewberry and you can join me every weekday 6 till 7 on Jubes & Kerr. Me and my panel will get stuck right into the day's events And I can tell you, in fact, I can warn you, expect some robust debate, some strong opinions and perspectives from both sides of the fence. It's about you at home as well. I love to read out all of your comments, or at least as many as I can. So join me, Michelle Dewberry, Monday to Friday, 6 till 7 on Jubes & Co.
I'm Mark White. As GB News Home and Security Editor, I cover those key issues that are so important to you. Our authorities, our communities doing all they can to combat violent crime. With the public services under unbearable strain, why are we still failing to control our borders? Defence, the first priority of any government, has been continually hollowed out. Can we trust our politicians to protect the armed forces? Join me, Mark White, on GB News.
We are GB News, the People's Channel.
And right across the United Kingdom.
You can find us on Sky Channel 512,
Virgin Media Channel 604,
Freesat Channel 216,
Freeview Channel 236,
and YouView Channel 236.
You can also take us with you on DAB Plus Radio,
with the GB News app and at the website gbnews.uk.
We're absolutely everywhere.
Come join us on GB News, the People's Channel, Britain's news channel.
It's 2:38. Very good afternoon to you. Loads of you getting in touch today. Really appreciate it. Thank you. Let's run through one or two of your views, and we'll start with Paul. Hi, Paul. He says, what makes railway workers any different from any other worker? Absolute disgrace that they're striking. No sympathy from me. Mick Lynch and the RMT are taking the employees for a ride. They have one objective, and that is to bring down the government. I think a lot of people would disagree with you, Paul. I understand what you're saying about railway workers being the same as everybody else. It's because the union leaders come on, don't they, and say, well, you know, our members have had a 20% pay cut in real terms over recent years. Well, yes, that's because of inflation and what have you. So has everybody else. So, yes, I get your point on that. Conditions is a big issue, though, isn't it? And not driverless trains, but guardless trains and all that sort of thing. But anyway, I get your point. Dave says the arrogance and self-importance of this man Lynch is jaw-dropping. Why would even more government money be poured into an industry which is run on outdated and non-productive methods and loses money constantly because it's expensive, unreliable and uncomfortable? David says, looks like the UK is giving up any pretence of maintaining any rises in GDP or staying as a major economy. Working from home, being paid to stay off work and striking for more money during a recession. Well, yeah, we have sort of, I was going to say had it good. We haven't had it good. Nobody's had it good. But we did get a lot of benefits, didn't we? And you know, the working from home was a benefit, really. It's a privilege in many respects, I think. And the furlough scheme, yes, it was absolutely necessary to keep people afloat. A lot of countries wouldn't do it. We did. So, yeah, again, I get your point. On the NHS, I think this is still Dave, actually, who says it's now recognised by almost everyone. The NHS has been hijacked by the left-wing medical unions and NHS management, who've allowed non-medical staffing and management to grow exponentially. Well, whether it's anything to do with left-wing unions or not, I have no idea. But I think management has certainly grown. And has that improved patient care? Well, perhaps it has. But not many people seem to be saying that in a very loud voice, so I don't know. Keep your thoughts coming through, gbviews at gbnews.uk. Now, I know you've got a view about this one. Prince Harry, in his latest interview, has said he'd like to have his father and brother back. That was all in a trailer for an interview ahead of the release of his upcoming memoirs. He's claimed the pair have shown absolutely no willingness to reconcile and also said he was betrayed by the family. Buckingham Palace, of course, not commenting, as you would expect. Let's talk to our Raw reporter, Cameron Walker. It seems extraordinary, Cameron, that on the eve of the book being published, Spare, in which we understand William is going to get a lot of stick, that Harry says, oh, he wants his brother back.
I know, it's very conflicting, isn't it? I think to many people are really questioning how someone who says he wants a relationship again with his brother, with his father even, would go on national, even international, perhaps television, and literally slates them, as he appears to be doing, by looking at these two trailers for the two separate publicity interviews for his memoir Spare, the first of which will be shown on ITV on Sunday with Tom Bradbury. Of course, they have a relationship. Prince Harry has a relationship with Tom Bradbury. They met when they were teenagers. They filmed a documentary together in Lesotho, I think it was. And then Tom Bradbury famously did that interview with Meghan and asked about her mental health. Again, in CBS in the United States, he's done a separate interview. The trailer alludes to the fact, again, similar to the Netflix documentary series, that there was palace leaking, palace briefing against Harry and Meghan to make them look like villains in order to make other members of the royal family look good. But then, with the ITV documentary trailer at least, we don't know what's said in the actual documentary, but the trailer is very much about reconciling with his family. The two don't quite add up.
It's quite difficult to see how it's going to go. Is if you've not got an interested party as an interviewer, don't you need someone who's going to actually look at this straight down the line and not have one preference one way or another?
A lot of people are questioning as to why Prince Harry and his publicity team have chosen these two particular individuals to interview him. It's understood that questions perhaps, or at least some of them, might have been submitted in advance. Some people are speculating on that one, so Prince Harry knows exactly, he can rehearse the answers. So,
which is unheard of in this business.
It certainly is. One of the big criticisms of the Oprah interview in 2021 was that Oprah did not challenge or ask secondary questions on some of the claims coming out of that. So if you remember, Meghan accused an unnamed member of the royal family of questioning what colour her son's skin would be when he was born. There was no follow-up question really on that. There was a lot of allegations about a lack of help for Meghan's mental health struggles. Again, there was no question, considering that Prince Harry spent a lot of time working on mental health when he was a working member of the royal family, with the Heads Together campaign, with the Prince and Princess of Wales, with the Royal Foundation, why he would allow that to happen, or why there was no help within the institution. So that was a big criticism of Oprah, and I think many people will be watching on Sunday both of those interviews and seeing if there is any kind of challenge to the answers that Prince Harry will be giving.
Yeah, and how explosive are we I mean, not particularly these interviews, I guess, but how explosive are we expecting the book to be?
The book, I think, is going to be more explosive than these interviews. I think the interviews themselves are going to be a bit of a repeat of perhaps what we saw on the Netflix series, but the book is going to go into a lot more detail. He's going to talk at length about his personal experience of learning of his mother's death and having to walk behind her coffin in 1997. We know that because in the blurb very heavily alludes to that particular event in Harry's life. We have heard over the weekends that he's going to criticise and give details about his arguments with his brother towards the end of his time as a working member of the royal family, that so-called Sandringham summit, when they were trying to thrash out the so-called divorce deal of what Harry's life would be like as not a working member of the royal family, the arguments he had with his brother. If you remember back in the Netflix series, Harry said that William shouted and screamed at him. So I think we're going to perhaps get more details on that. Interesting, the king, the papers, or at least, are speculating that the king is going to be left alone a bit. He's not going to get as much flack as perhaps we were expecting initially when this book was announced. But the king's red line is the Queen Consort. If the Queen Consort is perhaps criticised in any way, I think perhaps we will see a bit more of a fight back from the king.
Yeah, well, perhaps. Cameron, thanks very much indeed. Now, I don't know if you've done this. Are you doing dry January?
No, I couldn't.
No, I couldn't. Oh, dear, that's worrying. It's worrying, Cameron. Now, one of the most popular New Year resolutions is, of course, dropping the drinking, stopping it maybe for January or reducing it somewhat. But thousands of Brits trade in that post-work pint for a workout session. Is that you? Are you really going to do that? But why do many of us drink in the first place? And how many of us will rush to the nearest newsagent come October the 1st? Wow, what's on October the 1st?
October the 1st?
Oh,
I'm not sure.
Oh, who knows, anyway. Look, according to research conducted amongst 2,000 adults, 39% said they feel they can drink sociably and happily, but many relying on liquor to drive conversations. Yeah, I think we've all been there, haven't we? Let's talk to Professor Nutt, Professor of Neuropsychology, Neuropsychopharmacology, I should say, and an expert in what alcohol does to the brain. In fact, what lots of drugs do to the brain. Good to see. We've talked before, many years ago, and I remember you telling me quite distinctly that you thought alcohol was more dangerous, really, to us than things like cannabis.
More harmful, certainly, yes. In the current conditions, the current situation, alcohol is the most harmful drug in the UK because it's so widely used. But even if you were to compare it head to head, if everyone was using the same amount of, say, alcohol or cannabis, I think alcohol would be more harmful because it's actually somewhat more toxic than many of the other drugs people use.
Why are we so drawn to it, then, do we think? Is it because of what it does, or is it because it is such a social norm?
Yeah, that is a really great question. And historically, alcohol has been present with humankind probably since the very earliest times. There used to be a theory that we stopped being nomadic and we started growing wheat to make bread. And that's now been turned on its head by some academics who think we started growing wheat to make beer, and that beer was the reason we started to come together as large communities. So it is that sociability inducing effect of alcohol that makes it so popular, and that's why actually it's still in many ways a very good drug. The problem is it's intrinsically harmful, and there may be ways of improving on the harm. Sorry.
Oh dear, you're struggling like the rest of us, I think, David, aren't you? I would suggest a hot toddy, but I don't know if that's a good idea or not. I think part of the problem is, I think, when we look at modern society, is that you know the alcohol limits and things. What is it, 14 units a week? People look at that and shudder, don't they? Because I don't know anyone who sticks to 14 units a week. I mean, we do seem to have this dependency which goes way beyond anything which is considered healthy.
Well, for most people, drinking alcohol isn't that harmful. If you stick within the limit, there's very low harm. Even if you're somewhat outside the limits, the harm isn't great. The big problem comes if you really go way beyond the limits, because there's what's called an exponential relationship between consumption and harm. The harm doesn't go up linearly; it doubles and doubles and doubles, and that's where high heavy drinking is so much more harmful than low level drinking. And what I've been trying to do over many years is give people something which will give them the benefits that most of us want from alcohol, which is sociability and conviviality and a chance, to meet and chat to other people without anxiety, but with much less of the risks of these of the harms that alcohol kicks in at the higher doses. And of course, the problem with alcohol is it doesn't. For many people, it encourages them. The biology of alcohol is such that it makes them want more and more. And you know, people who are binge drinkers, they intend not to drink too much, but they end up consuming far too much. And I've been working to try to develop alternatives which would give people what they really want without much less of the risk of it running out of control.
Oh, well, if you come up with that, David, I think you're on to a winner, to be perfectly honest. Look, we've got to leave it there, but it's really good to talk to you. Thanks very much indeed.
A pleasure.
And if you're a sci-fi geek like me, you'll be thinking of synthahol, which is what they used to drink in Star Trek, which did exactly that, gave you a bit of a buzz, but didn't cause any lasting problems or even a hangover. So there you go. Maybe David's going to come up with synthahol. That'd be a very good thing. Now, talking of what happens at the beginning of this month, it brings with January a quadranted meteor shower, which is one of the most intense displays to grace planet Earth. Up to 200 meteors expected an hour, and the shower will peak overnight tonight and tomorrow. If you're keen to see the display, the Greenwich Royal Observatory has advised people to head to a wide open space away from light pollution, but unfortunately, might not be quite as mesmerising as usual, as we've got a very bright moon, which is going to spoil things a little bit. But if you're a proper space geek like me, you'll enjoy it anyway. Let's talk to Andy Lound, our favourite spaceman when it comes to all sort of things. Andy, great to see you. Where do we need to be looking and when?
Yeah, I mean, fortunately, it gets quite dark. It's usually best after 10 p.m, really. So it's going to be cold, so you've got to make sure you wrap yourself up really well. And really you want a good, clear piece of sky above your head. I mean, to be honest, the meteors can actually shoot around all over the place, but their tails all point backwards. They seem to emanate from the old constellation of Quadrans Muralis, which was an old constellation which no longer technically exists. It's not on the book, but it's up near the Plough, so that would be a good place. But they will shoot across the sky. The trick has always been on meteor showers, look in the darkest part of the sky. So you want to get away from street lights. You want to get away from buildings and things like that. But we do have the moon. And you need to allow yourself 20 to 30 minutes for your eyes to adapt to the darkness. That's really quite important. So you get almost like your eyes in tuned with the conditions around you. And the beauty of this is, even though we've got a moon, is some of them are actually quite bright. You often get quite bright fireballs associated with the quadrantids, which makes them an interesting meteor shower during the year.
What are we actually seeing here? I mean, it's just, if we know it's coming and it's a regular thing, then obviously it's the tail of something which we are regularly passing through. So what exactly is it?
This is a good question, because this is an unusual meteor shower. It's associated with an object that was only discovered in 2003, and it's got a sexy name of 2003 EH1. It's a minor planet, and it's thought to possibly be an asteroid, but it could well be a spent comet core. Now, comets, of course, get heated up. There's ices in there, and the solar wind blows the tails of dust and ices behind them, and every so often the Earth will pass through the remnants of this tail, and therefore we get meteor showers such as the Perseids and the Leonids. But we're actually getting the remnants of this object. And although we've only just discovered the object itself, this meteor shower dates back to 1825, when it was first identified by the Italian astronomer Bruscalassi. But a comet was observed in 1495 by the Chinese, Japanese and North Koreans, as we now would call them. And therefore it appears that this spent comet core is what we rediscovered in 2003. So we're looking at pieces of dust and pieces of ice entering the atmosphere at about 70 kilometres a second.
Wow. I mean, that's some speed, isn't it? I just find the whole thing fascinating with this. I find going back all that time to 1400 and whatever, I mean, it's less than a blink of an eye in cosmic terms, isn't it?
Oh, it is. It's fantastic. And a lot of the data that we get for modern comets that we observe and look at, we actually look back in the old Chinese records, and we're able to get accurate predictions for their orbits purely because they're very, very good observations. And that's what's really important. In fact, we've got some data from Babylonian tablets, which are actually quite important in cuneiform texts, which have been quite useful for us to actually predict the movements of these bodies. And comets are really interesting bodies in their own right. And if we've got a cometary core in a stable orbit, which orbits about every 5¼ years around the sun, then that's got to be a perfect target to send a spacecraft to at some point for sampling, because it will have calmed down by now.
Ah, yes. Now, that's an interesting point. Andy, great to see you. Thank you very much indeed. Oh, he's gone. Love seeing Andy Lound. He's our favourite spaceman. He's just a fantastic fella. Quickly, one or two of your views. Billy says, afternoon, Stephen, I agree with the nurses' strike, but people's lives are now at risk, and people may be driving past and tooting their car horn in favour, but it will change when lives are lost. And Ray says, has anyone looked at how middle and senior management pay has risen in real terms in the NHS? Cut the numbers, their packages and pay the workers as a result. The people are not political activists, they just want fair treatment. Perhaps a fair point. That's it from me. Don't go anywhere. Patrick Christie's is up next, right through till 6 o'clock.
Hello, I'm Aidan McGivern from the Met Office. Most of us will see outbreaks of rain today. It will also be windy and it will be mild. The wind's coming from the southwest at the moment, bringing a lot of mild air with them, but also bringing an awful lot of cloud, outbreaks of rain, a couple of weather fronts to watch out for. One has already pushed through, bringing a spell of rain earlier, but the next weather front is moving in for the afternoon and that will pep up the rain once again. So some gaps in between the spells of rain, especially in the east and for northern Scotland, where it stays fairly cold, but it is turning milder here, so the snow that we've seen eventually more confined to the higher tops of the mountains, and the rain replacing it. A lot of rain across the country, a strong wind, but that wind coming from the southwest, so it is going to be feeling mild, especially in the south. The rain, heavy at times as it moves through, could cause some issues for central and southern Scotland, particularly over higher parts, and it stays damp in the south as well through the evening and overnight. It's a windy night, but the winds, of course, since they're coming from the southwest, mean that it's going to be mild. Temperatures in many places in the double figures by dawn, just in the mid-single figures there for northern Scotland, where the rain eventually moves in overnight and then clears slowly through the morning. The rain also clearing the southern half of the UK, but in between there is a band of wetter weather for southern Scotland, for northern England and for Northern Ireland, that turning a bit more showery later in the day. And it's a mild day. Blustery, yes, but temperatures up at 14 Celsius in the south, 7 or 8 for Scotland and Northern Ireland. Some damp weather returning to Cornwall and Devon for a time during the afternoon and early evening, but that clears through. And then clear spells for many overnight on Wednesday night, showers in the north tending to fade away. Thursday looks like another showery day for many. Friday a little drier, but further rain or showers coming along for the weekend.
We are GB News, and we'd like to say thank you to each and every one of you for bringing us your conversations, for helping our great nation find its voice. We are here for you on radio, television, and online, across England, Scotland, Wales, and Northern Ireland.
It's not the BBC, you actually get your facts right.
We are proud to be GB News, the People's Channel, Britain's news channel.
Monday to Thursday, 9 p.m. till 11 p.m. Join me, Dan Wootton. I'll bring you the sharpest takes and hottest debates. Do you not believe in prisons?
I don't believe in prisons.
I'm completely stunned. I guarantee you there'll be no spin, no bias, no censorship.
I actually was personally quite offended by it.
And no reason to go to bed.
So I guess they've always been quite woke.
That's Dan Wootton tonight on TV, radio and online. Monday to Thursday from 9 p.m. till 11 p.m. on GB News. The People's Channel, Britain's news channel.
Hello there, it's Eamon Holmes here from Breakfast on GB News. We're not just on your television and your screens, you know.
We're on DAB plus digital radio, so you can listen to your favourite shows on the move.
If you've not yet listened to GB News Radio, it's very simple. We're on your radio player and TuneIn apps, on your smart speaker, phone or tablet, or online at gbnews.uk.
Take us with you wherever you go. GB News Radio.
You never have to miss a moment of the People's Channel.
Join me every Sunday at 6 p.m.